To the Northborough School Committee open meeting of Wednesday, November 4th, 2020. The time is now 6:31 p.m. And I call the meeting to order. All members are in attendance. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Northborough School Committee will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the district website at the URL listed in the publicly posted agenda. For this meeting, members of the public who wish to listen or watch the meeting may do so in the following manner. Live streaming, Education Channel, Verizon Channel 29, Charter Channel 194. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the district website an audio or video recording, transcript, or other comprehensive recording of proceedings as soon as possible after the meeting. All right, that said, we will move to our first item, which is audience sharing. And we ask that members who are in attendance raise their virtual hand. Is that working for this setup tonight, Greg?
It is.
Okay, let me look here. So if you raise your virtual hand, I see two already. We will one by one promote attendees. I do see two, and these are two community members who we heard from prior, which is always very helpful. So I'll let Greg promote one of, looks like Laura or Nicole.
Hello.
Welcome, Laura.
Oh, hi. Thank you so much. My name is Laura Hovey. I live at 27 Brigham Street. I want to first start by saying thank you to the school committee and Superintendent Martineau and all the administrators and staff, for all the hard work you guys do to support and strengthen our schools and really our community. I called tonight to speak about free full day kindergarten. I do want to recognize all the hard work that I know has been done to make, free full day K a reality in Northborough. But tonight I called to implore the committee to take this initiative across the finish line for the next upcoming school year, 2020, 2021. I understand, COVID, it's presented many communities, including our own, with a lot of hurdles to overcome. But one of the impacts this pandemic is having on our community that we can't overlook involves the pre-K students who are on track to enter kindergarten next year. As we all know, parents are experiencing financial difficulties due to the pandemic. And in addition, they're apprehensive about sending their kids into school settings. And so I think for both of those reasons, many families have decided against sending their children to preschool. I myself am one of those parents and did not send my youngest to pre-K. So I argue that with a greater population of incoming kindergartners missing out on those fundamental pre-K lessons and experiences that they would normally have, it's going to inevitably cause learning and achievement gaps as they enter kindergarten. And chances are really high that many of those same students will come from households that will continue to struggle financially next year and not be able to afford that kindergarten tuition. So I know that there has been a 3 to 4 year time frame put in place to phase out kindergarten tuition, but I really think it needs to happen now. Thank you very much.
Thank you, Laura. And Nicole, up next.
Thank you. Can you hear me?
Yes, go ahead, Nicole.
Okay, great. Thank you so much for allowing me to speak tonight and for all that you have done for our children, especially during this crazy year. The topic of tuition-free kindergarten is so important to me, and I appreciate your consideration. A little background on me: I have 3 children, 3rd grade, 1st grade in Peasley, and a 4-year-old set to begin kindergarten next fall. Prior to staying home with my kids, I was a speech language pathologist. I worked for New York City Public Schools, Boston Public Schools, Fairfax County Public Schools, and last, Northborough Public Schools. All but one of these school districts provided free kindergarten to their children. One of the reasons we chose to relocate to Northborough was the excellent reputation of the town's schools. My husband and I believe strongly in the value of public education, and we were very surprised to learn that full-day kindergarten was not free for all children in the town. In our eyes, this is a disservice to our children. As educators, we are taught how important early education is. Children who do not receive free full-day kindergarten can be negatively impacted academically, emotionally, and socially. Kindergarten has changed so much since we were children, and expectations are incredibly high. Kids attending full-day kindergarten receive more attention and are less likely to fall behind their peers. This year has been so difficult on everyone and put a financial strain on most. Like many Americans, for the first 7 months of the pandemic, my family's only income was unemployment checks. While my older daughter and son were both able to attend full-day kindergarten, I can't imagine the financial burden that kindergarten tuition would have put on us to send our youngest next year. Northborough is such an amazing town with incredible values and a strong sense of community. We've demonstrated time and again how important this is to us. In closing, thank you for all that you do and for letting me share tonight, and please choose to provide free full-day kindergarten for all.
Thank you, Nicole. You're at on Weston Terrace, right?
Yes.
Yes, 44 Weston Terrace. Thank you. Appreciate you sharing.
Thank you.
Okay. Any other hands? Now would be the time for the first round of audience sharing. Okay, seeing none, we will move to new business item B. And B1 is a legislative update, and I will hand it to Mr. Martineau to get us started with that.
So just a couple of quick updates on the legislative front. The first is that this Saturday, the MASC is holding its delegation assembly, and I believe Lauren will be representing the Northborough School District. And there are some timely topics on the resolution ballot, so it'll be an interesting event. I do also want to note that at the beginning of Saturday, there's also a free keynote speaker focused on equity and cultural proficiency. And that is being presented by Dr. Kayleese Warnham, who is a diversity coach and consultant, and most recently the Senior Director of Educational Equity for the Brookline Public Schools. So again, that is a free event for all school committee members, and for that matter, for our leadership team as well. A couple other updates in terms of the FY21 budget process. I think it's a rare occasion where we're still talking about the FY21 state budget in the month of November. I will share that Governor Baker did release his revised budget a couple weeks ago, and really held steady the level of Chapter 70 funding, which is what we predicated our budget upon. And also, we are just waiting for more information in terms of whether or not the House budget will make any changes to the governor's revised budget. The thinking is that we'll have a finalized state budget by December, but I do think that is also very optimistic at this point in time. And then lastly, the Commissioner of Education has granted authority to school districts to convert snow days or weather or climate days to remote learning days. So again, as part of our conversations with our teacher association, that was one of the agreements that we had with the MOA, that we would convert climate days or weather days to remote learning days, with the exception that if we lost power in the Northborough community, we would have a snow day. So we are working out the details, and more information will be shared with families in the next several weeks. And this is very timely with this past Friday's snowstorm. So if you don't like the weather in New England, just wait, and it will change very quickly. And that is my legislative update for this evening.
I was muted. Any questions or comments on that before we move to COVID-19 update? Okay.
All right, so so we're pleased to give a COVID-19 update to the committee, and we've been very fortunate as a community to have a medical advisory team organized and led by Mary Ellen Duggan. We have Dr. Carey, Dr. Costigan, we have our district physician, Dr. Medina, and Dr. Ciaranello, who is an infectious disease physician. And this team has been outstanding. And here this evening is Dr. Ciaranello to give an update on kind of the ever-changing landscape of the science behind COVID-19. And also, we'd like to speak a little bit about the COVID-19 screening program and some of the work that we're doing to try to move that program forward. So I have the great pleasure of welcoming Andrea, and I will turn it over to her. And Andrea, would you like me to make you a co-host?
So I can share my screen, that would be great. Thank you. Okay, does that work?
Good to go.
Okay, great. I can see you guys and my slides at the same time. Thanks so much for having me. I'm happy to give an update on what we've learned about schools and COVID in the sort of fall US reopening. I've been working with a team of docs from around the state to try to keep an eye on these data as they've emerged over the summer and fall. And so happy to try to give you guys an update about what we know so far. I think I'll start with my takeaways, kind of what are the main things that we've learned so far. And I think it's also just really wanted to start with sort of coming from a place of humility, thinking about the fact that these data that we have are really pretty limited, and they're definitely not what we would like them to be. But we're starting to see some trends emerge as the schools open up this fall. I think interestingly, we really started the spring and summer as a medical community thinking a lot about this question of whether children transmit more or less or the same as adults. And it turns out that that's actually a very difficult question to answer from the types of studies that we can do. We mostly have access to contact tracing and epidemiologic studies. And it's turned out that it's almost impossible to figure out who infected whom. So looking at a household, for example, to really know the timing of each person's infection. And so I think, this question of transmissibility is a really interesting scientific one that hopefully we'll be able to learn more about when this pandemic is over. But we've started to learn that I think for the kinds of decisions that everyone is making around schools, it's really much less relevant of a question than understanding the impact of all of the things that we're doing in the schools to reduce risk. So all of our mitigation strategies like masking and distancing and ventilation and things like that. And understanding the impact of sort of community transmission rates on all of these school outcomes as well. And so we're starting to see some data emerge about in-school transmission. And overall, it seems to be very rare. And surprisingly, it seems to be rare even in places with moderate or high community rates of COVID. And where it has happened, it seems to be associated with lack of masking. So I'll give you some examples that we've started to see about that. And then a couple of other things that we've been seeing emerge as really important issues are around testing and around screening. So access to testing for staff and students who develop symptoms has been really variable across the country and across the state, and has been an important issue in terms of how quickly people are able to get back to school and get back to work when they have symptoms. And then lastly, I think there's likely to be an important role for screening, which will, as Mr. Martin mentioned, we'll talk about screening asymptomatic staff and students may be really valuable in helping us stay in in-person school and potentially increase the amount of in-person school we're able to have without increasing the risk of COVID infection in the schools. So by way of background for me, I'm actually an adult infectious disease doc. So I take care of adult patients. And so my patients who are concerned about COVID risk in the schools are the teachers, not the students. So I kind of came into this work from that perspective, but I've had the privilege to work with a large group of people who include pediatricians and child psychiatrists and adolescent medicine docs. And then through that work, kind of realized that there really are several simultaneous things that are important to kind of hold true at the same time. So the first is, what do we know about kids and COVID? I think the data are becoming really clear that children generally become severely ill with COVID much less often than adults. As I mentioned, there was this big debate about the degree to which children transmit. But another really important thing to think about is sort of a balance of health outcomes. COVID-19, of course, is one important physical health outcome that, of course, we care a lot about, but there are a lot of other health outcomes too. And these include mental health and physical health outcomes. So we've seen a lot of the impact of being out of in-person school, so staying home, have included a lot of things like increased risks of depression, anxiety, suicidality, substance use. And then a number of physical health outcomes too, increases in physical abuse, unfortunately, and then interestingly, higher rates of both obesity and malnutrition. So just to put all this in the context, I think that COVID is a really important health outcome, but not the only one. And then educator health is a key priority. And I know sometimes this feels like it has been absent from the very public conversations, especially in the media. I think it's really important to remember that somewhere between 25 and 50% of educators are either themselves at higher risk for complications of COVID, or they live with a household member who's at higher risk. And so keeping them safe is absolutely critical. And sort of keeping that in mind every time we hear, oh, kids don't get that sick with COVID, but they're not the only ones in the building. And then considerations of equity, which I know this group has thought a lot about, but just to realize that across the US and here in Massachusetts as well, Black and Latinx communities have been really disproportionately affected by COVID, and also sometimes really disproportionately affected by the impact of the various school models that are available. So data from across the country show that Black and Latinx families have less often had an option to select in-person school. So for example, there may only be a remote option in their district. But also when there has been a choice, maybe more likely to select remote school instead of the in-person option. And there have been a lot of stories of students who actually did really well with remote school and found maybe that it addressed some of the concerns they had with in-person school, things like potentially experiencing fewer racial microaggressions or fewer race-based punishments. And so those, I think, are really important things to hear too. And potentially our role in improving the safety of school can really be just to give families a choice to make the decision that's best for them. And if we can, as much as we can make the school safer, kind of facilitate that choice being more balanced from a COVID perspective. And so another really key piece of background, I think, is sort of there are two really important factors, I think, that impact the risk associated with being in school and COVID. So the first is, what's the risk that someone with COVID will kind of walk in the door? And that's really a function of the community rates, kind of what's happening outside the school, and then also people's out of school exposure. So what are they doing on days off school? And then if they do walk in the door, what's the risk that a person with COVID-19 will transmit in the school? That's where all of these mitigation strategies that this district's been working so hard to put into place really come into play. And we're starting to see are being really effective. Things like the masking, distancing, hygiene, ventilation. I really like this sort of Swiss cheese model of COVID prevention. So this is originally from the Cleveland Clinic, but it's also put forth by the Children's Hospital of Philadelphia. So sort of thinking about all of the redundancies that we can put into place to prevent COVID. So if we have all of these things, masks and distancing and ventilation, et cetera, can really kind of minimize the chance that a little virion sneaks through all of these holes and gets to our student or our educator. So what are some of the data that we're starting to see in the fall? Previously over the summer, we had really reassuring data from international settings, but that was generally places that had extremely low community rates. And then what we're starting to see in the fall is that data from Europe, particularly the Spain, Germany, and the UK, show really no impact of their fall 2020 school openings on the community rates outside the schools. And they had large numbers of students in the school with very few outbreaks. So this is even as their sort of rates are starting to rise again over the fall. And then New York City is conducting random testing of asymptomatic staff and students. And so as of now, they've tested more than 81,000 people and had only 117 positive staff or students, so a rate of 0.15%. And then for 2 weeks now, DESE has reported data from Massachusetts. And again, these are not in-school transmissions. These are just people associated with a school in some way who've been in a school building who had COVID. And so out of about 75,000 staff who've been present in the school building in the last week, 77 have had confirmed COVID, so 0.11%. And out of about 450,000 students, 197 or 0.05%. So these are, I think, low rates, oftentimes lower than in the community surrounding, which I think is, doesn't answer the question about whether transmission is happening in school, but I think is reassuring that we're seeing lower rates in school associated people than we're seeing in the communities surrounding. And then this is a great source of data. It's not perfect, but it's, I think, the best thing that we have. So this is put together by the American Association of Superintendents and Brown University, and this is a dashboard that's online. And they've asked schools from across the country to contribute their data about their educational models. Are they in person, full-time, remote, hybrid? What are they doing in terms of distancing? What are they doing in terms of masking? And then they're tracking COVID, confirmed COVID cases in students and staff. So there's definitely voluntary reporting. It's not entirely clear to me which way that will lead to bias. I think in medicine, we often see that voluntary registries have higher reported rates than what's actually true because people are sort of motivated to report a bad outcome. Then there may be the opposite bias here as well if people are sort of not wanting to report COVID associated with their schools. So it's hard to know which way that goes. And then there's no formal statistical comparison. So you want to ask the question, well, is hybrid different than remote? And we can't really answer that from a statistical sense here, but you can start to see some trends in the data. And again, these are school associated cases. No effort is made to try to figure out whether these cases were transmitted in the school. But overall across the US, it's about 0.5% of staff and about 2.2% of students who have had COVID. And then I think the data are a little bit squirrely. Like I tried to look at mask versus no mask or 6 feet versus not, and they just don't make any sense. So I think they're just really limited as a reporting, like the data reporting is limited, but I think it's interesting to look at these. So this is all schools together, students and staff, people in remote only environments, and there's no data reported for students, people who are in a hybrid or reduced capacity school of some sort, and people who are in full in-person school. And I tried to put them so that the scales would be the same, but for students overall, there's the 0.2 and the 0.5 that we mentioned. For remote, for staff, 0.35. For hybrid, 0.18. Again, 0.5 for staff, so not so different. For full-time in-person, maybe slightly higher, 0.3% and 1%. And if you play around with like staff only and full-time in-person and no masks, it goes up quite a bit. So I think this is just an interesting source to watch. Hopefully, as more and more schools and districts report to it, we'll start to be able to make more conclusions from these data. And then some cautionary lessons. So I think it's important to think about, as we're starting to say, well, I think it's looking pretty reassuring that we're not seeing in-school transmission, let's push back on that and say, well, where are we seeing any sort of signal of risk? Like, where should we be worried? And I think there's a couple of sort of related reports that might be useful. So one is a CDC report that looked at 3 daycare centers. Well, it looked at all daycare centers in Utah, and of them, 3 facilities had any sort of in-facility transmission. And when they looked at what had happened, the students were mostly unmasked. Again, it was daycare, so they were very young. But in the places where these clusters or outbreaks occurred, the staff were unmasked. And in one case, the case with the largest outbreak, a staff member also worked while they had household contacts at home who were ill with COVID. And then that staff member later went on to develop COVID. So I think, keeping people home when they're a close contact and masking, universal masking, I think is what we've sort of learned from that. And then I've been looking pretty hard to see if we can find reported data of in-school transmission. It's very hard to find. So there's one example from Lincoln, Nebraska, which is anecdotal in the lay press. So kind of take that with a grain of salt. But they reported sort of 4 examples of in-school transmission that involved 9 people. So 2 separate instances of high school students transmitting to each other. Both were associated with lunch. One was lunch inside and one was lunch outside. 2 staff members who worked in a shared office. They were not in a student-facing role, but they shared an office, and they did not wear masks in the office, and they, one transmitted to the other. And then 5 staff members who had lunch together without masks. And then I think the Israeli middle and high school example from the summer is pretty well known by now, but that was a place where 2 students came into the school while they were symptomatic, and transmitted to like 100 people. But that was in the setting of very crowded classrooms. So they had brought their schools back. They had lifted their class size restriction. So they had like 38 kids in the rooms. And then they had a heat wave. So they removed the mask mandate. So everybody was unmasked and crowded. And then over a 2-week period, there were just a huge number of transmissions. So I think we can sort of learn some lessons about what not to do from these, which I think really seems to focus on, just everybody wearing a mask primarily, and then staying, some distance apart. And then Mary Ellen gave us these Northborough, Southborough data, which I think people have probably seen, but I thought were really, really reassuring in terms of in-school transmission. So as you guys know, there have been 23 confirmed cases associated with the schools, sort of people walking in the door. And then there were, from these 23 cases, there were 93 close contacts identified and quarantined. 78 of them were full classroom quarantines. And then only 1 student was quarantined it was identified as a close contact from a school activity that was non-classroom. I don't know what this was, but maybe it's like sports or a club or something. And then all of those people were tested and none of them were positive. So I think, for locally, these are the best quality data. Well, these are the best quality data that I have seen, but they are also locally reassuring that, that we are finding people walk in the door with COVID, which is not at all unexpected in the context of moderate community rates. But those people are not then passing it on to someone else in the school building. And so I just wanted to highlight this sort of variation in thinking about, thresholds for opening, these sort of community transmission rate thresholds. I think there have been a lot of really nice policy guidance documents put forth by Children's Hospital of Philadelphia over the summer and fall. And they've actually revised their most recent recommendations. And along with that, they gave their conclusions of the review of the data from the US as well. And so they basically concluded that strong school safety plans have successfully mitigated the risk for transmission in schools, even with communities with moderate incidence, which they define as more than 35 cases per 100,000. And remember, we're sort of popping up into the red when we're over 8. And then they say that although mitigation strategies such as masking, distancing, and ventilation can withstand a higher community incidence, that tipping point is really not known. So at some point, maybe it's over 35, there will be just so many people that no matter how much you mask and distance and ventilate and whatnot, you might not be able to prevent transmission in the school. I don't know what that tipping point is, and I think nobody knows, but it's probably pretty high. We'll run into issues associated with just having too many people quarantined to be able to operate a school. I think before we might see in-school transmission if people are really doing all of these mitigation strategies. And then they note that most school-associated transmission has occurred outside of the school or because of poor adherence to masking. And they highlight several examples from student gatherings outside of school, from shared meals among staff, whether that's in the break room at school or a dinner, on a weekend outside of school. And then youth sports, they spend a lot of time talking about it and really note that most of the transmissions they've seen have felt to have occurred actually off the field of play. So very close together on the sidelines or people in the locker rooms, or meals and pasta parties and things like that. And they also highlight this important issue that teachers and staff and caregivers are more likely to become ill with COVID than kids are, and potentially maybe more likely to transmit. And so they flag the need for really flexible sick leave and adequate space for breaks and eating for staff being really important. And as I mentioned, they revised their previous community incidence rate thresholds, which I think is important. And we talk a lot in Massachusetts about the 4 and the 8 per 100,000, but I thought it's super interesting to look at what else is happening around the country. And so probably not surprisingly, the thresholds really differ. So Arizona's threshold for moving to remote school is 100 per 100,000. In Washington, it's 75. In Oklahoma, at 14 or 25, sort of gradations of by grade level moving to hybrid. The Harvard Global Health Institute has put out a lot of guidance, and they have thresholds that are 10 or 25. Ours, as you know, are 8. And then DESE clarified on the 22nd of October, maybe it's Governor Baker on the 22nd in his press conference, said that, you know, we have these thresholds of 8, but really, if you are already having in-person school and your community goes above 8 for some period of time, you really don't need to go back to remote automatically, as long as you have no evidence that there's in-school transmission. And then the previous CHOP guidelines, as I said, were actually quite low, but they've gotten rid of them now. And then most of these guidelines also recommend considering test positivity rates, and they keep a threshold of 5%, which is based on the WHO. CHOPS is a little higher, actually at 9%. It's not crystal clear in any of these guidelines what you're supposed to do with these 2 metrics. So you have a positivity rate and you have a rate per 100,000 in the community, and you know, do both need to be true? Does one need to be true? So it's a little bit sort of left to the, you know, user's discretion there. But I think the value of the positivity rate is to tell you sort of how accurate are your community incidence rates. So I think those 2, that's kind of how those 2 things can go together helpfully. Okay, maybe I'll stop there because I think that's it sort of from the data updates on transmissions. And so maybe if people have questions, and then we can talk about testing.
Great. Thank you. Questions from the committee or anyone? Sorry, guys, just switching gears here. Mrs. Frank, please, go ahead.
Thank you, Keith. Question for probably according to the one slide that you, and thank you very much, Doctor, for your presentation, which was very, very, very helpful. And Mary Ellen Duggan, I have a question probably for her. The one slide that I'm referring to is where you had the Northborough, Southborough district-wide COVID data. But I'd like to know, because this is a Northborough K-8 school committee meeting, I'd like to have the data for that. That would be the confirmed cases for Northborough K-8, the close contacts at the district K-8, and how many were and how many classrooms were affected. And Mary, through the chair.
Give me a few minutes and I'll get you that info, okay?
Okay, thank you. I appreciate it.
It's pretty aggregate right now. I can get that for you shortly.
Okay, thank you, Mary Ellen.
There's also the dashboard. I think people have probably seen that Mary Ellen works really, really hard to put out twice a week. That includes it's a snapshot of that week, but cases at the time and quarantines and things like that.
Okay. Mrs. Bailey-Jones, please.
Thank you so much, Andrea, for your presentation. I love data, so I found it really interesting. I was wondering if, sort of from a broader lens, you know, we spoke in August about this, at least thought that the fall would hopefully, you know, rates would stay low, and then, you know, we really weren't sure what the winter would bring. So we were really hoping to be in schools as long as possible. So I'm wondering, you know, with this current data that you just presented to us and with the way things are going, do you think that, you know, that timeline of pushing out as long as possible hybrid learning, do you think that that's a possibility? I guess I'm just looking more big picture here.
Thanks. Are you asking sort of hopefully how long will we be able to continue hybrid learning before we would have to pivot back to remote?
Yes, exactly. Remember how we sort of said there was that sweet spot of time where it would hopefully be safe to be in schools in a hybrid model. So I'm wondering, do we have a longer sweet spot now according to this data?
I think so. I mean, I think the way I've been sort of thinking about it is there's not that much we can do about the chance that someone walks in the door with COVID, but we can do a lot about making sure that if they do, they don't spread it to somebody else. And so that going to school doesn't increase your risk of getting it any more than anything else you might be doing in the community. And so I feel like that's kind of where we are. You know, we are seeing cases, which is totally expected, but we're not seeing transmissions in the school, which I think is excellent. So, I mean, the medical advisory team, I think, is meeting weekly and talking about this weekly and making sure that we're still thinking this is what we're seeing. But as long as we continue to see that, I would be very comfortable continuing in-person school because I think the benefits are clear, as we've talked about, and we're not increasing anybody's risk by bringing them into the building.
That's really helpful. Thank you so much.
Anybody else? I do have one.
I have your data for you.
Oh, yes, please go ahead.
So just to let you know that the district dashboard, we did update it this week. That shows the different towns, the number of positive cases over the past 4 weeks, the different districts, and the number of cases and the cumulative number of cases. So it's, I think, a little bit more direct than it was in the past and easier to read. So in Northborough, K-8, we've had 4 positive cases in those schools. And of those, there has been 32 close contacts. 2 were full classrooms, cohorts. And there's been no positive cases from any of those close contacts.
Thank you, Mary Ellen, for getting me that data. I appreciate it.
You're welcome.
I do have a question. Not sure if it's for Mary Ellen or Dr. Ciaranello. And also I'd like to echo the comments, Dr. Ciaranello, about how much we appreciate you joining us and ongoing. I know there's a lot happening behind the scenes, and joining us this evening. It's always very helpful to be able to engage and ask questions. So we really appreciate the gift of your time and expertise. It's invaluable. What's been weighing me down a bit is, do you foresee that there'll eventually be a way to test out of quarantine? Are we waiting for other tests, more research? Is there any path to getting out from underneath that 14-day quarantine scenario?
That is a great question. I think it is being actively discussed. Like, I saw something from the director of the CDC sort of highlighting that they're working on that. I think we have, reasonable data from we have sort of moderate quality data on, like, what is the probability that a test would be falsely negative at different numbers of days after exposure. And they're not great data, and most of them are extrapolated from people who went on to develop symptoms. So what we don't really know is anything about those test characteristics in people who never get symptoms. I think everybody's really hopeful that that might be true. Like, if you could test people repeatedly for several, at some interval that at least went out through 8 or 9 days, maybe we would feel better about that. And I'm hoping that there might be some CDC guidance on that sometime in the next few months. But as of now, I think it's, the incubation period is variable, but it's almost always like less than a week. It is officially stated as 2 to 14 days, but it's just the tail end of the curve that goes out to 14 days. So it's pretty uncommon. So I would say, I think we're hopeful, and hopefully the field will move in that direction, but it would probably be hard at a policy level to do that in advance of the CDC or DESE. And DESE actually proposed that initially and then kind of walked it back over the summer because it didn't align with DPH and CDC guidance.
So I'm thinking that we might see 8 to 10 days at some point in time, but nothing less than that.
I can't really imagine it being less than that.
Okay, well, that's very helpful just to get the explanation. And it sounds to me like it's something that's being actively monitored on behalf of our district, the research and the guidance. Okay, thank you.
I would love to shorten it. I think everybody would.
Yeah, it can feel pretty long, the 2 weeks. I even say that from my wife's a high school teacher, and she misses her kiddos for 2 weeks, and they want to go back. So yeah, it's tricky. Okay, any other questions? I believe we'll be continuing, but shifting gears on medical. Yeah, okay. It looks like you can proceed. I don't see any other hands.
Okay, and are we okay for time? I don't know how long you want me to talk.
I think we're good at the moment.
Okay. just hush me if you want me to move on. So a couple of points about testing that I think might be helpful to go over. One is just terminology. So these terms get used a lot and often not quite precisely. So when we talk about diagnostic testing, it really refers to people who have symptoms that might possibly be due to COVID. And we talk about screening, that's really for people without symptoms to try to detect their asymptomatic infection and stop onward transmission. And then there's also this idea of surveillance, which is similar to screening, but it's really done at the group level. So for groups of people, the goal will be to identify infection that's somewhere in that setting. So I think a nice example is sort of like wastewater from a dorm. Like if you find SARS-CoV-2 RNA in the sewage, somebody in that dorm has COVID, but you don't know who, and then you could go back and sort of test everybody. But that surveillance testing in and of itself doesn't identify an individual result. And so testing for symptomatic students and staff, you know, as I mentioned, there's not great data on it, but anecdotally, it's been really variable. Some people have been able to get in the same day, get a test, and get the result within, 24, 48 hours. I think it's really important to try to continue to work towards having good access to testing. And Dr. Medina and Mary Ellen and others have really done, I think, an amazing job trying to identify places where people can go around the area. Even making it easy by having like a standing order from Dr. Medina where you can just call the school nurse can fax it in, and so you don't have to call your own PCP and wait to be seen. And so I think that's been working pretty well. It's really important, I think, because the easier we can make it, I think, the more likely people will be to accurately report their symptoms. If they know it's going to be easy and pretty painless, they'll probably say, oh, you know what, I actually have a sore throat and a little cough. Whereas maybe if they knew it was going to be a hassle and a lot of waiting and a week out of school, they might sort of try to be like, oh, I feel okay. And then it also really, I think, is important for preserving educational days and for averting substitute staff costs, because you can just get people back to school and back to work that much quicker. On the flip side, if they test positive, of course, you can isolate and do contact tracing. And then we've been talking a lot about suggesting the use of PCR tests over the rapid tests, just for better accuracy, avoiding not as much of a concern really about false negatives, but also a lot of false positives. So both false negatives and false positives. And so suggesting that people get the PCR when they get tested. Mary Ellen, was there anything you want to say about sort of diagnostic testing?
I think that what we've seen, SAFTAR was gracious enough to collaborate with 2 sites for our students and 1 for our staff, and the turnaround time has been less than 24 hours recently for that. So we've gotten the staff back in, with just missing 1 day of work with symptoms and a negative test. So it's been very critical in that, having that quick turnaround time.
And anecdotally, I think that this district is doing a phenomenal job. Our friends and colleagues working with other districts where the access has been really limited and the delays have been very long. And so I'm grateful to all of that work that you guys did to put that together. And then the next idea is sort of screening. And I know the survey went out and people were asked to give information about what they thought about this. So I think I just have, 1 or 2 slides on this and then happy to sort of talk through it and take questions if that's helpful. But coming back to the sort of Swiss cheese model, I think that screening is really just like one more tool in our armamentarium that we might be able to do to kind of further put into place a way to interrupt transmission. So the idea would be just to try to identify people who didn't know they had COVID before they could pass it on to other people. And it's been extremely widely implemented in many colleges and universities, and actually quite a lot of K-12 private schools in Massachusetts as well. And one of the things that I think is interesting is that it's hard to really understand the impact of a screening program because it's hard to know what would have happened if you didn't do it. And so sometimes I think computer models are helpful there because they can simulate sort of, the movements of people through the schools. Here's the kids interacting in their classrooms. Here's the teachers interacting with the kids. And so some computer models have suggested that if you could implement weekly screening of students and staff, you could potentially have a 5-day in-person school at the same sort of total infection risk as you would have in a 2-day hybrid model without a screening program. And that becomes all the more true, and the benefit of it is all the greater in places where you have high community transmission rates, which makes sense. So more people walking in the door, you can interrupt more of that transmission before it happens. And because of that, I think it's been a growing area of interest for public schools as well. And I think initially just the cost of it seemed insurmountable for public schools, but there is a really important initiative, I think, called the Massachusetts Safer Teachers, Safer Students Collaborative, which was initially led by Wellesley and Watertown, and now has grown to 12 or 15 districts, including ours. That's really trying to figure out some of the logistics around how we could implement screening in public schools. And so part of the work of the collaborative is sorting out logistics, like what's the easiest way to screen people? And do you use saliva? Do you use an anterior nares swab? And do they collect it at home and bring it in? Or do you collect it at school? And who does that? And how do you, if they collect it at home, how do you link the specimen with the barcode to the person correctly so you're not messing that up? And then the other, I think, value of it has really been to put pressure on the vendors to bring the prices down. Because as soon as people started, there's 15 districts that want to do this, it's been interesting to watch, every week on the calls, the vendors come up with a way to get the prices down a little bit. So, so that's, I think, been really interesting and really exciting. And that it is being done in other places around the state as well. Cambridge and I think also Arlington are doing their staff. New York City, as I mentioned, is screening lots of people. And then there's sort of a smattering of districts across the country trying to do this as well. So I think it's a really nice way to potentially just, make our current learning model even safer, protect our educators as well as our students, and then potentially permit additional in-person schooling. I think that's where I was going to stop.
Andrea, can I just add on a little bit about the screening? So just to update everybody, we did a second round of screening for our staff. We offered it last week. We screened 501 staff members. So that was as part of another pilot, as part of the original pilot that we did. So the staff is very grateful for the screening that we've been able to get. So we're just working with that collaborative to hopefully get more weekly screening done.
And can you remind us, Mary Ellen, what kind of test that is for those screening programs?
Oh, the ones that we got as part of the pilot program, they were saliva PCR tests. So the first time we had 3 sites. It was before we started in-person school. It was a few days before we started that. And so we had 3 sites that the staff signed up for an appointment and went to. This time we did it in each school. So the staff just needed to stop by the nurse's office. They get scanned in. They went in, provided their sample, and then brought it back to the nurse's office. So it was very convenient. They didn't have to go anywhere, just to the nurse's office. So.
And is there a cost? Is the district paying for these, or is it a grant or?
We were part of a pilot program. So those 2 screenings did not cost us anything. The first one was as part of a pilot for this company. And the second one, they were trying to test their system. They had a lot of different schools across the country testing on the same day to make sure they could handle that influx of test data coming in.
Okay, thank you. Questions for either? Oh, yeah, Mrs. Frank, go ahead, please.
Thank you, Keith. Mary Ellen, on the 501 staff that were tested, what would be the percentage of our total staff? Because I'm sure we can't make this mandatory. Am I correct?
So we've had it's close to between 65 and 70% of our staff participated.
65 to 70?
Yes, each time. Yep.
Okay. And can I have a follow-up, Mr. Keith?
Yes, please continue.
I might have missed it in your presentation, but out of those 501 staff that were given the test, can you state if any tests came back positive?
Yes, they did.
They did. Okay.
And I think that's the benefit of this, because nobody was symptomatic. So you stop the spread before it actually happens.
Okay, thank you.
Thank you, Mrs. Frank. Mrs. Tagliaferri, are you all set for now?
Yep, she asked my question.
Okay, thank you. Anybody else? Okay, Mrs. Gannett, you're muted. You have the floor.
Sorry, I was quick. A quick thanks. My daughter, I was trying to tell her to be quiet while I just asked a question. So I'm thinking we might be talking about this later, but these were free. Are there any other free testing opportunities ahead, or is it just the potential funding thing that the email was?
So nothing's free coming up that we know of. There's a cost associated with everything. The potential coming up is pooling testing, which Dr. Ciarinello kind of explained, where you put that's where the cost is coming down to less than $20 a test. Some as low as $11, $12 a test. And maybe this week when we have our meeting, it'll be even lower than that. But there's new testing opportunities coming up. And the state does have some antigen tests that they have procured, and districts could, they're Binex now. I'm sure some of you have heard it in the news, and districts could say that they were interested in it. We did not. This was a phase one. We did not do that because it really didn't seem practical at the time, because we would do the tests. The nurses we would have to get certified to be able to perform the tests, which would be a cost. Then we would have to have biohazard waste removal, which would be another cost. And the antigen tests, both the positives and negative, would need to be followed up with a PCR test. So it really would not benefit anybody in the long run, and would just add a lot of confusion into the whole testing process. I think the only reason that the medical advisory team could really see to do it is to gather data for future testing options. You know, comparing the results with the PCR tests following up.
Kelly, I will add that the town has given the school district $100,000 to the CARES Act, which needs to be expended by the end of December. So we are looking at ways we can set up testing or screening from now until the end of December. And especially with, with the trending data, as well as the increase of potential travel of our families and our faculty and staff, we're trying to think about a strategic way where we can implement some testing to, again, get a sense of the prevalence of COVID-19 and cases in our district. So that more information will be shared as we move forward that process.
Thank you.
So Dr. Ciarinello said maybe I should clarify my statement about the positive tests from our screening. The first time around we had 0. This time we had a very low number.
Thank you. Any other questions at this stage on this topic? Okay.
Well, I'll just through the chair, I'll just add that this has been a recommended mitigation strategy since the very beginning. In addition to all of the masking and the hand washing, and we do feel like it is a path forward to really thinking about increasing the in-person learning time, especially for our youngest students, our elementary, K through 3, and hopefully 4 and 5 as well. And again, the price point of these screenings is getting to a point where there's more hope in being able to systematically implement these screenings. So, and that is the reason behind the fundraising effort, that we really don't, as a district, have the funds to purchase testing, and we're really looking at a community partnership and donations to be able to create a 20-week screening program that we could run hopefully from January to the end of the school year, and have weekly screenings for our students and staff moving forward.
So there'll be more to come on that, right, Mr. Martineau?
Yes, and the survey has been extended through this Friday. So the original due date was today, and we extended it through this Friday. And as of this evening, we had, I think, over 900 responses. So we can encourage people to participate in the survey, that would really help us make informed decisions.
It looks like that topic has sparked some questions, so we'll hear from Mrs. Gannett, please.
Yeah, I think my concern with the fundraising for it is just that it seems like it's such a large expense, and I know the benefits in the long run and all that, but it just seems like such a big expense, and the understanding that the way that the tiers would go is top down, so that was another thing that do to make sure that people understand that if you're an elementary parent and you're paying for it, that doesn't necessarily mean that your kid's going to get tested, things like that it's unfortunate that there can't be testing funded from other sources than families.
Kelly, that's what that whole Safer School, Safer Teachers, Safer Students collaborative is trying to do, is trying to procure low cost, valid testing for all schools, not just the ones that can afford it, for all public schools is their ultimate goal.
I think we spent a lot of time over the summer working with Jessie to try to encourage, first a way to quickly and easily test people with symptoms, and then second, a way to start to build out these screening programs. And I think they have suggested at this point in time that the districts kind of develop these protocols on their own. I'm really hopeful that if we can demonstrate this, these are the challenges, these are the implementation issues, these are some approaches that worked and some that didn't, that we could put this forth at the state level as something that they might be interested in supporting. I don't know how much support there will be for that, but I think it's totally critical from an equity standpoint. I think one of the explicit goals of the collaborative from the beginning has been to try to, figure out the logistics and get the pricing down so that it could ideally be offered to districts that that are really still in remote school completely. Boston Public Schools and Worcester Public Schools and things like that. Could this be a way that we could do some work on our end to sort some of this stuff out and then be helpful towards, permitting more in-person school across the state?
Thank you. Are you all set, Mrs. Gannett? Good, thank you. Mrs. Bailey Jones, please. Thank you.
I think Andrea just helped answer part of that, and maybe this is more for Mr. Martineau. With the idea of this screening happening regularly, would one of the end goals be to allow certain groups of students to participate in-person learning on a more frequent basis?
Essentially, we could look at the number of students who participate in in-person learning. That was part of our reopening strategy from the start, looking at students who really need to be in school more often as a result of their individual needs. But yes, it's to maintain, but also to look at the path forward to increase in-person learning for our students.
Thank you.
Thank you. Mrs. Tagliaferri, please.
Greg, of the 900 or so responses you've gotten, what's the overall trend? I've spoken to several families and most people are very well on board with testing. They very much want to provide funding. They very much want to help with fundraising, but that's obviously a very small sample. Are you finding that to be true across the board, or is there a big variation?
Yeah, so the data is very preliminary at this point in time, but we're seeing anywhere between an 85 and 90% interest in participating in a screening program. And then obviously we have, between, I would say 10 and 12% of people who would select not to participate for a variety of reasons. So again, I think working with Andrea, we're really trying to look at what threshold makes sense in terms of percentage of participation. And if it's too low, it really is not a good use of funding. And I think, Andrea, correct me if I'm wrong, we're looking at that 85% participation rate as kind of a floor for participation.
Yeah, I think nobody really knows what that number is. There's definitely a place below which you're not going to get the benefit. And so it's not worth even the money. Let's say we're half the people, it's not worth even half the price because you're just not going to get the full benefit. But that actual threshold is kind of not well defined. I think most people are guessing it's around kind of 75 to 80-ish, I would say, but it's not a very firm number.
And so, Greg, based on these survey results, at that point, will you determine if you're going to move forward with the fundraising, or when do you expect to know if and when we will launch this fundraising effort? I know we talked last night about, people who are really interested in helping with the fundraising and, certain people whose jobs will match the fundraising and people wanting more information on that. At what point will we kind of know if we're going to move forward or not?
So I think when Friday the survey closes and we have data to analyze, and then I think having the medical advisory team and the leadership team take a look at the responses, kind of analyze the data and make a decision to move forward or not. I've also reached out to NEF to see if they would partner with the district and help kind of facilitate the mechanisms for collecting the money. So their initial response was they'd be more than willing to help, and they're going to get back to me. And we'll be also seeking some similar partnerships in Southborough. So I would imagine by midweek, about a week from today, we'll have a good sense.
Okay, that's great. Thank you.
Mrs. Frank, please.
Yes, I'd like to piggyback on the Kelly's thoughts on the fundraising and also the tiers. Seeing that the first tier would be administrators and teachers, to allow more of that funding to go to the next tiers, which would be Algonquin, then which is the second tier. Third tier is the middle schools, Northborough, Melican, and Trotter, and then the fourth tier is the elementary students. Can we check in or ask the staff and administrators if their health provider would provide any funding for this? I mean, I think this might be something new that health providers may be saying this is a good initiative because it would lower cost of the clients that they have, prevent them from going into more doctor's appointments or even hospitalizations. So I would like to see, even though that this has never been offered before as a benefit, it could be something supplementary that might be added at this time. So, because if we can get more administrators and teachers to have that paid through their health provider, that would allow more of that funding to go than to the other three tiers. So I'm glad to see, Greg, that you've reached out to the education foundations, because in doing some research about this and to educate myself about this, I went on to what popped up was the Wellesley Education Foundation, because they were doing the fundraising through that initiative, and they have the mechanism. They may have the whatever is needed in the banking regulations, because that's another financial thing that we'd have to look at. But could I ask a question, Greg, because you did share a question about the survey, because you did share that to us as a school committee member. Can I ask a question about that survey?
Sure, just with the understanding that that's a snapshot of time, and the data is still being collected.
I just had one question. Sure. And it was like, how many, the answer came up as the word Massachusetts. And it was like, are you willing to fund and provide funds for this? And several of the people, it came up as the word Massachusetts. I didn't see the questions and the responses. It was just one word, Massachusetts. I was wondering what that meant.
So I'm not sure, Joan. I'll have to look at that more closely. The data that I did share with you is a quick dashboard. Okay. So you actually don't have all of the comments that were shared. So before sharing that, you typically, a team of central office folks kind of go through the data to make sure that it's acceptable to share and it doesn't reveal any confidential information. So that was just very preliminary, and I'll look tomorrow to see what that is. I'm thinking it might have been a word cloud of some sort.
I know, and I was trying to go back to the original survey to see if it was a multiple choice or something that they select on that. And then the last thing is, I think it has to be really communicated to the parents. When I looked, like, are they willing to support that? And a lot of people said, yes, if my student gets this testing. But I think this has to be really, these are the goals for tier 1, tier 2, 3, or 4, so people understand. I think it has to be, maybe just a little more clear to them. But I applaud the initiatives if we can do this to keep the kids in school, keep our teachers and our students safe. I think it's a good initiative. I think everybody is trying to think out of the box how to do this. And I appreciate the other initiatives through the district with the MIT study and doing those 2 testing, the PCR for the staff. So thank you very much.
Maybe I can just answer the insurance question. I think there's been a big advocacy effort nationwide to get payment from insurers for COVID testing, and thus far has been successful in terms of getting payment for COVID testing for people with symptoms. But there are almost no insurance companies that are paying for COVID testing for people without symptoms. And so I think that's a tough avenue for individual people to try to negotiate. But I think hopefully something that could change at the policy level at the state or the federal level, but probably difficult currently.
It would be nice if they would. I mean, many
I agree.
They give you, so much money if you belong at fitness reimbursement, right? And so that's for your overall health, mental, physical. And so it would be nice if they would give a reimbursement to some kind of preventive, before you actually have to be diagnosed with COVID.
I agree completely. And then just a couple, I'm happy to answer questions from parents and community members too. I think I've gotten a few phone calls and Facebook questions since we started talking about this and put the survey out. If people have more questions, I'm definitely happy to talk through it. I've been trying to encourage people to kind of decouple the question of whether their child will be tested from the question of whether their child will be able to go to 5-day school, because I think the decision making around the different grades may be different. The data from all of the sites across the country suggests that the risk of the rates of overall cases are much lower at the elementary level. And we're not seeing in-school transmission really at any level, but definitely getting back to this question about really are kids more or less likely to transmit? Are they more or less likely to have symptoms or be tested? It's still very unclear, but the number of cases at the elementary level has been much smaller. And so I think you could make a case for getting the elementary school kids back full time, even if they're not being tested, and make a case for testing the older kids as a way to either keep them in hybrid school as the rates go up or potentially get them into school more days. But I've been thinking a lot about educator health and sort of educator comfort, like just feeling not worried. And so I think there's a huge value in that too. If we're screening the staff and we're screening the older kids who we think are more likely to bring COVID in the door, I think it's hard to quantify the sort of assurance benefit of that for the staff, but that's another benefit to your, potentially like to your children's teachers and thus to your children's school experience, even if your own child is not the one getting tested.
If I could just speak to the health insurance piece.
Please.
So if somebody is symptomatic or if they are deemed a close contact by the Board of Health, then the insurance plans generally cover it. But I do think it's worth having the conversation with our health insurance companies and see if there's something that they can do to assist us with this.
That would be perfect, Heather. Any assistance possible.
All right. I don't see any other hands up. Looks like we're ready to shift gears again. And that will be back to Mr. Martineau to decide who's next on his team.
Sure. And through the chair, if we can just skip back to audience sharing and have the principals give a quick update of some of the successes that they're finding in their schools, that would be, I think, appreciated.
Yeah, that's fine.
So who gets to go first? How about Alana?
I was gonna say I can start if you'd like
She
me
had
to.
her
It's
hand
like
up. Yeah.
I did. I had my little hand up. So we have started to really settle into some nice learning routines, both in the hybrid model and standalone remote model. Parents are engaging in conferences with teachers. They started this Monday and will continue next Monday. And then there's some additional times for our standalone parents the following week. Conversations have been really positive, focused on sharing information, developing goals for children. And teachers have reported that it's been so nice to get to know parents in this, these unprecedented circumstances. So very positive all around. We're looking forward to one of our favorite activities, the turkey trot. And we have a group of amazing fourth graders that started a kindness club, and they're branching out into the community with the work they want to do. So we reached out to Mary Ellen Dugan, and we got a list of things that the food pantry could benefit from. And we're going to do the turkey trot both in the hybrid model and in the standalone, so that there's a connection for all the students and donating food needed items in the community. And we continue to work with our PTO to build enrichment opportunities for all of our students. We're doing some really creative out of the box thinking, and we're always emailing and sharing ideas. So we're really excited about some events that we'll have coming up the next few months that we're working to get scheduled for all the students and to bring them together as one community.
Thank you.
I can go next if Jennifer at Lincoln Street School. So piggybacking on a lot of what Alana said, it's been super busy over the past few weeks. Last week, we had our virtual open house for parents where obviously we couldn't invite families in. So teachers put out slideshows for parents to participate in, and we had some great feedback about that. As Alana said, we had our parent-teacher conferences, which have been going well, and we will continue with those next week. Yesterday, teachers were engaged in a professional development day, and we've received some good feedback about that as well. And the afternoon, the teachers were provided with some time for collaboration, which obviously there just doesn't seem to be enough hours in the day for, so they were appreciative of that time. We've been working with our PTO on surveying our staff about enrichment opportunities, and the teachers gave us a lot of information about how we can support them this year. Our PTO is also sponsoring the Scholastic Book Fair, which will be an online event this year. So that starts on November 7th and runs through November 20th. In our 5th grade, I was able to get into the classrooms and hear some of our students give their speeches to run for student council. So those results should be coming out soon. And I'm looking forward to working with those students. And we already have a lot of great ideas on how to support our students at Lincoln Street School this year.
I think I can go next. So I'd like to report that I continue to get to learn a little bit more about Peaslee. Getting to know the students and build relationships with them has been a real priority. Last week, I was able to meet with 5th graders. They shared their ideas about the ways that they could be of service to our school and to build a stronger community and have some fun together. It's interesting, their perspectives and reflections are really important as we make our plans for the spring. They talked about maybe perhaps having a scavenger hunt, some end of year celebration events, even building a maze. We really want to put them to work. Also, my conversations with teachers, what they have on their minds is getting to know their students even more. They've begun to pinpoint some high yield practices to make the most of their time with students. The teachers are discussing ways to target specific areas, and they're getting creative about how to meet the needs of students. We've also started a networking meeting with parents at Peaslee. It's a way to bring parents together and talk about some meaningful things, to share ideas, explore practices together. We know we're partnering with parents even more so than we ever have. And so being able to provide some support for them has been really critical. To really also, as an elementary principal group, we've talked about ways that we can provide some outreach to parents by creating some resources, and then also even exploring some sessions where we would provide ideas and maybe even some experts for them. We too continue with our traditions at Peasley with our Veterans Day project, some spirit days, including food drives. Our PTO has organized our virtual book fair. They're exploring some fitness fundraisers to fund enrichment and then also to build some community spirit. And we look forward to our first all-school meeting in the next few weeks. Thank you.
Thank you.
I guess I'll go. Just I wanted to give an update about our hybrid and our standalone remote programs. Over the last month, we've only had a little bit of movement. We've had 5 students move from hybrid into our standalone remote program, and we've had 2 students go the other way from hybrid into, from standalone into hybrid. So we were able to make those moves with a lot of collaboration with families. There are a lot of different reasons why families need to make moves, and our teachers have been very flexible and accommodating, and we've been able to do that. Additionally, we continue to take data on our students who are in person 2 days a week that are on IEPs. And after phase 2 of our data collection, we offered in-person learning 4 days a week for a few more students. So we're up to 64 students that are in person 4 days a week. And we added another layer to for some families who wanted this. And we have 4 additional students who attend 3 days a week. We also began a program recently for standalone remote students for whom the model just was not working for the students in terms of accessing the curriculum, but there were other reasons why families did not want them included in-person learning as much as our hybrid students. So we have brought in 3 or 4 students who are participating in standalone remote to do that in school between 2 and 4 days a week, just so they get teacher support as they're working their way through that. And that's been really successful for those students. So we continue to be as adaptable as we can. Our teachers have been very flexible and accommodating. So that's been nice. And our parents have been wonderful about reaching out to us when things come up. And when we can, we are able to work together to make those changes. One of our school improvement goals focuses on literacy and reading across content areas. And so I'm really excited that our literacy teachers have begun our small group comprehension and fluency groups. So we have between 1 and 4 students in a group, and currently we have 21 students that have been identified as general ed students needing some extra supports. So we took data that we had from last year, and that was kind of where we started. There are plans in place for additional data collection moving forward. So that's exciting. Last Thursday and Friday, we invited faculty, staff, and students to dress up in costumes at the middle school level. We have not done this for over 20 years for a whole lot of different reasons, but we wanted to generate some spirit and also couple that with asking for donations for the Northborough Food Pantry. Like other principals in Northborough, I think I understand, and our staff and our students understand, that food insecurity is a real issue, and we wanted to help with that. So we raised over $500, so that was great. We had a lot of participation, bus drivers, some of them dressed up, some of our custodians wore some fun hats. So it was just fun to generate school spirit and to give back to the community. So we have plans for some more spirit kinds of days and possibly a small food drive to help the food pantry. So we're excited about that. And just yesterday, it feels like longer ago, but we had the first presidential election where voting happened at the middle school. So all 4 precincts voted at the middle school. This is the first time that happened. That's a huge undertaking. And with the record levels of voter turnout. It was a lot of traffic at school yesterday, but it was really wonderful. And it was nice to collaborate with Andy Dowd, town clerk, Bill Liver, chief of police, as well as other people. And I really have to thank Bud Richardson and his staff for really being accommodating and flexible and just so helpful. So it went really, really well. Again, a lot of people in and out of school yesterday, but it was really, really exciting, and it was there's a lot of energy, so that was great. And then we have our parent-teacher conferences coming up as well. So ours are after the elementary conferences, so November 16th and the 23rd. Those will be half days for students, and we will be having parent-teacher conferences. Our team leaders and teachers are working really hard to schedule those. They're also creating a common template to use this year with a process for really concrete action steps that will come from these meetings. It's just so challenging to meet with folks virtually, and we really want to make the most of that time. So they're working together on that. So lots going on. Just like everybody else said, it's really, really nice having the kids in person. Teachers are still teaching outside as much as they can, and things continue to move forward.
Okay, I'm going to jump in next. So I think you can hear lots of common themes across the schools, and I just want to again thank the teachers and the principals and all of the faculty and staff, because not only are they working so hard, which you can hear in all of the reports, but they really are being lead learners. And I think one of the things we're really seeing is that everybody is in learning mode, trying new things, innovating, and continually tweaking and adjusting and adapting. Yesterday, we took the day to focus on our learning, and I just want to give you a quick summary of what happened yesterday in the PD day. In the morning, we focused on the whole day connected to aspects of our strategic plan. The morning really focused on the strategic objective of equity of opportunity and healthy and balanced learners. And Rhoda Webb and several teacher leaders who she works closely with worked together with our keynote speaker, Sarah Fireman. And Sarah spoke to us about unconscious bias and the tool of using windows and mirrors as a way to combat unconscious bias. And then Rhoda and a team of facilitators led school-based discussions to talk about how does this apply in our lives and in our curriculum and in our schools. So that was the morning. And in the afternoon, as many of the principals mentioned, the focus was on school-based learning with different site-based activities and time for collaboration across teams. And Julie Doyle also was able to launch the Learn platform, which is one of our technology tools, and that was launched yesterday as well. So it was a day full of learning, and that's, I think, where I will stop.
And I think that is it for principal updates.
All right, it looks like Keith maybe stepped away, so maybe I'll just take over. All right, thank you so much, principals and Stephanie, for your updates. I really appreciate it. Let's see, so I know we hopped sort of back to audience sharing. Greg, was there anything further for COVID update, or are we ready to move on?
I think we are ready to move on.
Okay.
There's 2 questions, Lauren.
Oh, I'm sorry. I apologize. Joan first.
Okay, thank you. I guess my question that I have could either be answered by Greg or any of the principals. Now that we have 1 full month into school, and this is the first time when parents aren't able to come into the schools at all, I was just wondering how that was working with students that forget things at home, parents have to drop them off, or students are excused from school. I just wanted to know, parent pickup and that, how is that working now that the parents cannot come into the buildings? And then I have another follow-up I like.
So I'm the least qualified person to be answering that question. So I'll have Michelle, do you want to speak to that?
Sure. I can speak at least at Melican, but we put in protocols at all the schools as part of our reopening plans for all of these kinds of scenarios. So at Melican, we have a drop-off table right outside under the awning, and we check it, every hour or so. So parents know that they bring items and they leave them and they label them. Surprisingly, kids forget much less this year than they ever do. Or parents just don't bring it. I don't know which, but we have far fewer items dropped off at school. And similarly, we have far fewer kids coming in late and leaving early. So it shows me that they really can do it and they can remember things. But that said, we do have kids that are picked up early, and parents either call or email us ahead of time. And then when they're in the parking lot, they call in, and one of our administrative assistants or some staff member walks the child out, checks the ID if we don't recognize the parent, and then signs, and off they go. When kids come in late, they ring the buzzer like they always would. They come in, they check in the office, and we get them up to class. So it's been very seamless, and parents have been wonderful. We're able to get kids really quickly when we need to and get them out to parents who are waiting outside curbside, and we deliver the kids right to the car. So it's gone very well at the middle school anyway.
Thank you for that. I think all the pre-planning and the organization and thinking of the different scenarios is so important, because this again is just another aspect of what the COVID has given to us, and not to us, to you as educators and leaders of the buildings, what you have to take care of. And I was glad that you highlighted the thing that if you don't know who the parent is, if you're not familiar with them, a familiar face, that you're asking for identification. So I think that's the safety of the student is most important at this time. Thank you.
I also do think parents really understand and respect that we can't have visitors. They're very patient. We have students that are at home in standalone remote, and their Chromebook stops working or something like that, and they call, and we're very responsive, and we are able to get them a Chromebook, and we meet them at the door with a new Chromebook, and they've been just wonderful. It's been different. Obviously, we like having folks in the building, but everybody's just worked together, and everybody understands what we're trying to do, and it's gone very well.
Okay, thank you. And then my follow-up question, Greg, could I ask a question to Keith Lavoy about the buses?
Absolutely.
Okay. Keith, my question is that one of the principals highlighted that there were students who were going from the standalone remote to the hybrid and back and forth. And I remember one of your presentations that you made, you said that if parents were requesting a change, it may take some time. So I was just wondering, how is that working if we just have a few students? Are we able to make those changes and provide the transportation fast, or is it taking some time to do that?
Actually, Joan, it's going amazingly quickly. Anytime these types of requests come in, I think we are down to between 24 and 36 hours to make the adjustment. Our ridership data has been coming in, which is lower than expected and lower below the capacities of the buses. So we are able to add students without having to rearrange anything, which was going to take the time as we predicted earlier. But as of now, we're able to honor requests within 24 to 36 hours.
Thank you, Keith. That's really great. And thanks for the pre-planning and organization and thinking out of the box on that. Thank you so much.
My pleasure.
And Joan, I'll just add to just Keith and Jean Pinto have been really wonderful. Jean is very quick, and she works collaboratively with our administrative assistants and can make the change very, very quickly. Sometimes within an hour, it's all set and ready to go. So, and our bus drivers, just a little shout out to them. They've been very flexible. They've been very positive. They've been very wonderful this year as well. So it's just been just a collaborative and a very positive and supportive experience all the way around.
That's wonderful, because I think it helps a lot of parents with the angst if they had to wait 2 or 3 days, and even the student who wanted to come back, or vice versa. So it's glad to see that that is working out very well. You guys did a lot of planning in the summertime, and you worked out all the different scenarios. So my hat's off to everybody, and to Jean and to Keith and all the principals. Thank you so much for your reports.
All right. Sorry, guys, I had to step away a minute ago. I had to take my contacts out. So did you cover for me, Mrs. Bailey-Jones?
I did. And it looks like Erin just has one question left.
Yeah, I appreciate that. Go ahead, Erin, please.
Just a quick question. I know Michelle touched upon it at the middle school. How many changes have there been across the district with kids switching from standalone remote to hybrid or vice versa? Michelle, your numbers seem pretty low, which is great. Has there been a lot of movement at the elementary level?
Stephanie can
So-
field that question.
Yeah, so I don't have the exact number in front of me, but I would say that in terms of movement, I'm going to estimate and then I can get you the exact numbers. Movement into the SART program, we had a waiting list and then we reviewed at the beginning of October, and then we've been moving those people who were on prior to October 9th, and that was about 20 people.
Okay.
And
that's K.
And that's K to 5.
Okay.
And that was moving from hybrid to standalone remote. There have been a small number of moves also in the other direction, but I don't have the exact number in front of me, but I'm going to say they're around 10 plus or minus. I think principals, I don't know if that sounds right to you. And that's again, K to 5, because Michelle gave you the numbers for the middle school.
And are there still kids on the waiting list to move to standalone remote?
So there are still a couple of kids that from that original waiting list that we are still in the process of moving. We sort of developed transition plans in every case. And now there is a new waiting list that is forming, and that has about 7 or 8 kids on it so far.
Okay, thank you.
Yeah.
All right, no more hands up at the moment. Are we moving to to Becky's presentation?
So I think Becky and Keith will present the COVID-19 financial impact during the superintendent's report, during the monthly general fund expenditure report section.
Okay. So would that bring us, is the COVID-19 update complete then?
That is complete.
Okay, perfect. Thank you. Okay, so that would bring us to item 3, or B3, I suppose, which is a discussion about agenda and school committee meetings. And I think, can I present at the moment, Craig?
I believe you are the co-host, co-host, Keith, so you should be all set.
Let me try screen 1, screen 2. Let's see. Is that working?
Yes, that's working.
All right. Last time I tried this, my computer blew up, so that's a start. All right, so quickly, just 3 sub areas here we're going to walk through. What I would like to do is just get some feedback and have an open discussion with the committee and as well as central office on a few of these topics. So the first one is the meeting format and place. So obviously we're meeting remotely at the moment under the governor's orders, and we have the pandemic context as well as we were in the middle of our transition from Milliken to Lincoln Street School, which hasn't been revisited in a while, but at the time that we last evaluated it, it was not ready for in-person meetings, much less so for physically distanced in-person meetings. And part of the readiness was with respect to NCAT having what they need as well to be able to handle a physically distanced in-person meeting in the Lincoln Library. And then, of course, we can layer on top of this the state and local orders and regulations. So I don't know if you have anything to add just on that backstory, Greg.
And I just would echo, the conversation that we did have last spring about moving, the meetings from Milliken to another location. And that was a discussion, and I believe was agreed upon at that time by the committee to do that research and make the move this fall.
Yes. Yeah, that was all I believe that must have been pre-pandemic, timeline wise. So I guess I just want to get some feedback from the committee and or the central office regarding in-person versus remote meetings. It's my broad perception that theoretically, at least, we could do either. So that's just one thing to get feedback on at this time and have a bit of discussion about. I see Mrs. Gannett. Please go ahead.
As difficult as Zoom meetings are of handling, I'm actually a pro of them. One reason, it's convenient. It's kind of nice to be home. As you saw, my daughter needed some mommy time, so she decided to come in to the meeting. Which if I was at school, I wouldn't be able to do that, you know, if we were at a school building. So, and I also think it's more people could attend the meetings virtually. I know we have a low audience number tonight, but typically they've been pretty high over the summer and over the things, which has been nice that more people have been able to participate.
Thank you. Mrs. Frank, please.
Thank you, Keith. My feeling is that I like the idea of going to Lincoln Street. Okay. Especially hearing about when Greg was mentioning about the ventilation system at the middle school, that they found out that one of the ducts, the ventilation ducts was blocked. And so that has taken care of, but we've been there for all those years. I'm thinking like, maybe that's the reason why we would have, you know, in May and June, it'd be so hot and stifling in there and have the fans going. So I love the idea of the move to Lincoln Street. I think right now, seeing the regulations as you have it in there that, you know, the governor is having, even at the state level, you know, starting Friday, we can have no more than 10 people in a meeting. And I believe that if, just like we'd have to be wearing masks. And if you have 10 people, right now, if we have participants of 22 people, we may have people shuffling in and out of the room at the same time. It might be harder if we have masks. And the other thing is that I'm concerned about if we go in right now into an in-person situation, our meetings run kind of long, and that means that the custodial staff is waiting until we're done to take the room apart, get it ready for the setup for the kids the next day, and it would have to be be sprayed. It would have to be cleaned down. So that gives more time, and I would like that custodial staff to be ready first thing in the morning for the staff, and after they get done cleaning the building in the afternoon, I want them to go home because we have no idea what's going to come up. I think that, you know, when we first went to remote, I was thinking, how are we going to do this? And I think we became pros at it. And I think that everything that has happened as far as all the actions that we've taken, all the good feedback we've received, all the wonderful presentations we've done have been exemplary. And we have been able to take votes. We've been able to do reopening strategies. We've been able to look at COVID testing. And we've been very well updated with everything so far. So it would be nice to get back into, you know, in-person learning. But I think right now is not the time. Like Kelly said, the participation has been high. One of the highest meetings we ever had, I think, before we voted in the reopening of schools, we had 400 people that were in the audience. I was thinking, what would we have done? I think it was a joint meeting. We'd had to go into the auditorium of Algonquin Regional High School. So I think we've had even good representation, even at the format of our K-8 meetings by having 2 audience sharing. So in the short run, yes, it's going to be great when we can do it. I can't wait until we can get back into person meetings, but I think right now we're doing okay. We're doing very well. And the staff is doing an exemplary job. So, and even all the board members. So I think this is a good place to stay for right now.
Thank you, Mrs. Frank. Very good feedback. Mrs. Bailey Jones, please.
So I will echo what Kelly and Joan spoke about in terms of allowing our audience to participate. We had someone either at our last meeting or the meeting before, and I remember the mom on the phone, she said, you know, thank you for letting us participate as citizens through the Zoom call, because otherwise, you know, she said she wouldn't have been able to come to the meeting to speak. So I think, you know, in our post-pandemic life, not just Northborough, Massachusetts, but I think really the world, I think that we're going to be thinking about how can we use technology for our benefit to allow more citizens to be involved in these types of meetings. So I don't know what kinds of conversations you, Keith, and Greg, you've had with NCAT about when we do go back to in-person meetings, whenever that will be with masks, maybe after the pandemic without masks, whether that virtual component of participation could remain in place, or whether we go back to the traditional way of having the members of the public come physically in person to our meetings. So that's just sort of something I've been thinking about, is that ease of access for our community members.
Yes. Yeah. I would like to tear off of a few of those comments. It took me a little while to warm up to the remote meetings. I'm a big people person, I guess. So, but they've grown on me, I think, like everybody, as we worked out the kinks, and some distinct advantages have come to the surface. Certainly with respect to scheduling, I have a 1-hour commute, and so able to meet at much earlier. If we are doing remote meetings, that flexibility, I can do it at the office before I come home. So there's that. Mrs. Frank's points about just the human and even financial costs of cleaning up after a meeting in the current circumstance, when everybody's pushing so hard at the moment, certainly seems relevant. I was really struck by NCAT. There's a lot of things to do to get the Lincoln Library ready for us under normal circumstances, and I'm guessing here that they were running behind on that process because of the pandemic, derailing everything from the spring on. But it was significant to get the library ready, so it's not there, at least last I heard. And I actually do agree with Lauren that the holy grail now, right, is like, how do you mix these two worlds? How do you provide the benefit and convenience, you know, to maybe some, for people to have a choice about how they're attending, and how do you get those together, and how do you get them on the media, you know, with in partnership with NCAT. So there's a lot there. There's a lot to it. So that's all very good feedback and very helpful. For sure, I would say we would just periodically revisit this, more so when and if there's a significant change in the context, as far as, you know, school operations, pandemic, and everything. Probably wouldn't really be sensible to do so before any significant changes, but if that's something we could do, I think that would be beneficial, just so we can all stay on the same page as we go along. Greg, did you have anything to add on the place and method format?
I echo a lot of the same remarks, and I would just comment that, like our teachers having to rethink and reimagine how they teach and how they work with students, the school committee has had to rethink about how it conducts and manages and runs the business of a school system. So I think it's also a nice example of how technology can be effective in communicating, sharing information. So the school committee knows how to run in-person meetings. So this was the same learning curve and same journey that our teachers have been on during the pandemic. So I just wanted to highlight that.
Okay. Thanks, everybody. Moving right along, meeting times. The backstory is we used to meet at 7 in person. And then we had some good feedback from membership. I can't remember who was the driver on that. But we shifted to the 6:30. Was it Kelly? Kelly's smiling. So we went for 6:30. And I also, the reason I'm bringing this forward is kind of twofold. One is I think that the 6:30 time was built on an in-person consideration. People were commuting, getting there in person to, at the time it was Milliken, of course intended to be Lincoln after that. And the second part of kind of the twofold considerations here is the meetings have gotten longer. Luckily we're settling and we've pulled back a bit, but we had many meetings, of course, over the summer that were quite long. And I haven't done the math recently, but I'd guess they're still on average longer than they used to be, and probably will continue to run a bit high as long as there's still a COVID-19 update section, is my guess. So that's the backstory. So the question is, should we consider other meeting times, start times for our regular open meetings in light of those circumstances? So just taking feedback on that. Mrs. Bailey-Jones, please.
I personally like the 6:30 start time, just because, I guess with a normal length of a meeting would mean it would end slightly earlier. And I am not a night person, I'm a morning person. So for me, I guess that's probably selfish for myself. But one thing I did want to sort of note about the meeting times. So I went to the MASC, like the delegate assembly practice last weekend. And so we were talking about how long will the delegate assembly last? It's on Zoom this year. So will it be longer? Will it be shorter? So the conversation actually was, they think it will be longer because when you're in an in-person environment, you sort of have that push to get the work done so that you can go home. But when you're already at home on a Zoom, the meetings may actually tend to go longer. Now, this was just sort of how the conversation went. I don't know if that is telling of why our meetings have been going longer. I think it's really because of the content we've been talking about. But that could be a consideration as well, as to maybe one of the reasons they've been going a little bit longer too. But I still am in favor of the 6:30 meetings.
And just to clarify, thank you, Lauren. I'm wondering on both ends of that time, right? So 6:30 versus the old 7, or 6:30 versus 6 or 5:30. So just taking feedback on any of those fronts. Mrs. Gannett, please.
I could go earlier.
Just anytime, just whenever, 9 a.m.
If someone wanted 5:30 or 6, I would not be opposed to that. But I would say 6:30 too, if people want to keep it at 6:30, but I would be opposed to going to 7. I don't want to go later. Wrong direction.
Having been the driver on the 6:30, that kind of makes sense. Your stories are consistent, so they're believable. Thank you. Mrs. Frank, please.
Thank you, Keith. I think one thing we have to take in consideration is to ask the administration what's also their input. I know sometimes as a chair, when we had in-person meetings, sometimes meeting with the superintendent ahead of time, and sometimes we'd meet maybe sometimes if the meeting was at 7, we'd meet maybe at 5, and then the meeting gets the in-person meeting with the superintendent would sometimes get done, and then you're just standing around and waiting for a half hour. So I second Kelly's and Lauren's comments about starting even 6 or 5:30, because I think that you'd have to ask Greg and the administrators what time would work with them. So they're just not having a wait time in their buildings or at central office or coming to Lincoln Street and just waiting, because I think that's time that is wasted on their part. Because just as I was talking about the custodians, the administrators, everybody that is on our agenda has to get home and has to be at their A game the following morning. So if we can get started earlier, I think that's all the better. But I would also ask the administration how they feel about a time and find something that's convenient with the school community members and administration.
Thank you.
Just echo Kelly's remarks, except that I think it should be 5:30 a.m. No, I would defer to the principals, I think, and the directors. To me, it doesn't really matter what time the meeting is, although I do prefer the 6:30 over the 7. And I would imagine if we polled the principals, the earlier, the better. That way there's less of a gap of time between their end of the day and attending this meeting. So again, I would defer to the principals and the directors. Put your thumbs up if you like 5:30.
Oh, no, not AM.
Not AM.
Yeah, and I'm thinking more about the remote ones at the moment. Obviously, we've used some discretion by necessity as we went through all the special meetings and just the pandemic, the context there, and how long meetings were and everything. So we're kind of in that gray zone right now as far as run the Zoom meetings, run the governor's order. So maybe Greg, if you could get some more feedback on that, we could look at another modest shift or something where the sweet spot is at the moment for everybody with everything they're juggling, all the extra work, et cetera, et cetera.
People
we'll send out a survey.
I'm sorry, say again, Kelly.
Do they want to comment tonight? Or?
Yeah, that's certainly, I'm taking notes. Or we can follow up either way.
I guess, the one thing I would ask administration right now, if it's remote, is just checking that everyone can get home by 5:30 if they're doing that, because most of us are traveling home beforehand. So whereas I think Joan's point for if we're staying, that's dead time, but if we're remote, just making sure people travel all different distances, I think, on this team. So just double checking that, I would say.
I would just add that that's just managing schedules as well. So when we know the meeting time is, people can add in their commute time to making the meeting.
Yep.
Okay. Erin, please.
No, I agree. I think starting earlier the better. And I think if everybody just remains flexible and open-minded as we do at some point transition back to in-person, and know that, that time may need to change. Keith, if you're working and need to drive back, maybe we need to push it back later. But I think for the Zoom time, the earlier we can start, the better, if it works for everybody.
Okay. Well, I think there's more to come on that. I think we'll get some more feedback from building leadership, and maybe we'll try a slight shift and see how it goes. We'll get more feedback. We learn as we go. Appreciate all the comments. Last part of this is agenda, order, and items. So the backstory is in the late summer or leading into the regular meeting schedule, Greg and I reviewed the agenda policy and also looked at the agenda in general and kind of just stepped back and said, what are some things, how can we maybe make this better? What are some areas where we could try to improve the agenda and really subsequently the way meetings are run. So as you guys know, we've tried a few things. We stole this from the Southborough playbook, which is the audience sandwich. I think that really exists because, you know, if you have just the beginning versus just the end, there's kind of drawbacks either way. Making people wait to the end is what we used to do. It's a bit unpredictable as far as when audience sharing will occur. So that would be one observation. We certainly have gotten some feedback from some community members that it's been helpful for them to have it be predictable, especially you know, parents and whatnot. The having it at the end gives an opportunity as well for people to make comments. It's a little less clear to me at the moment. We've been getting mostly front loaded with audience sharing, so I'm feeling less strongly about that. Theoretically, there could be beginning and middle. We could really, you know, try different things. So just would like to get some feedback on that. I'll just run through all of these and then I'll just take feedback. I think it'll be more efficient. School committee member reports is also new. It's an ad basically. So just to clarify, what we've been working with is just order as well as a few ads. So everything that used to be in the agenda, everything that's in the agenda policy has remained in the agenda. School committee member reports. The main driver of this is giving school committee members a designated place where they give their reports. This is mostly liaisons, subcommittee, if the chair has anything to report. Instead of having it, it used to be in audience sharing and at the end. So it's just kind of tacked on there. So again, this is many other committees in the state do this, and so it's something we've been trying. And then the last part is principal participation. And mostly, you know, where does that fit best? In my view, the principals kind of report to Greg and indirectly to us. So his opinion matters there, and of course carries a certain amount of weight. But two prongs are: where should that occur, and or is it sensible at a minimum, you know, in our extenuating circumstances, to allow them to be able to leave after all the key portions that they should either listen in on or participate in have been completed. So I'll take feedback on any of those as well. Mrs. Bailey-Jones, please.
Thank you. So starting with the audience sandwich, I think it gives community members the opportunity based on their schedule to share, and they have a definitive time at the beginning where they know it will be with the start of the meeting. And then for anyone who has maybe circumstances where they can't make the beginning of the meeting, although we haven't really seen as much participation at the end, I think it is nice to also sort of leave our meeting with some ideas from our citizens. I like the idea of school committee member reports because it does give it a little bit more formality, even though we had been doing it in audience sharing previously. And I do agree, especially this year, our principal's time is really, really valuable. And so especially, you know, like right now, maybe what we're talking about isn't quite as pertinent to their time when they are probably putting out a million other fires. So I would definitely support a model that's probably similar to Algonquin, where the principals give their reports at some point during the meeting. And then if they wish, they are free to leave so that they can use their time wisely.
Very helpful. Thank you. Appreciate the feedback. Mrs. Gannett, please.
Yes, I agree. I like the audience sandwich. I think it's a nice to start and finish. School committee members reports. I think it's nice to have a designated area. And then I would defer for principal participation to the administration and to the principals to see how they feel about it. But I would support, if they did not want to be there, I would support, you know, the entire time. I would support them leaving it.
Thank you. Very helpful. Mrs. Frank, please.
Thank you, Keith. I like the addition of the 3 bullets. I like the audience sandwich because you have it at the beginning and the end. The school committee member reports, it designates it in a certain place. And I think the principal participation attendance, yes, it should be under the direction of Greg and superintendents. And I like the idea that if we're going to be having principal reports, is that it's as close to the top of the agenda. And I know in past superintendents, it was up to their discretion. The superintendent would talk with the chair and say, I would like to excuse the principals at this time because there will not be any other further agenda items that will involve them. Because I think we have to, as I said about any staff, custodial, that, and especially the principals, they need to get back home and they need to recharge and be ready for the next day. What I would propose is, if we're making these changes, is that it does go back to the policy subcommittee. We do have a policy B180. And if we're going to be adding audience sandwich, or we're talking about school committee member reports, as it's listed on our agenda tonight, it's not listed in the policy, and the policy that we have for it says specific things that should be listed. And if we're making these changes as we update any other policies, the last time this one was revised was October 30th, 2017. I think it would be a good thing to put it in there so that any new members that come in, any new administration, it's our guidelines, and that's what guides us in our business. And it's then everyone can refer to it, even if it is to Cheryl Lepre, administrative assistant, somebody who is writing up the template, that would be right there in the policy. So I would like this. We did have a policy subcommittee on just this past Monday, and we were looking at other policies. I was just an audience member, but they were looking at new policies to look at. And I think this is one that could be revised very easy.
Thank you, Mrs. Frank. Very helpful. I think that is it for this. On that note, then, I would like to get Greg's feedback regarding, especially the principals. They're still on with us, and see where we're at for today.
No, I think I agree with all of the suggestions for changing the agenda. And I agree also, Joan, that if we can bring it to memorialize the changes in the policy, that will be helpful for future committees. Keith, I think we had an experience this summer with one of our joint meetings where audience sharing was at the very end, and it was at 1:30 in the morning. So that was very difficult for people to wait that long to communicate. So I think these are great changes, and I fully support having the principals share their information and then having them, giving them the ability to leave the meeting and continue on with their other life outside of this work, which they are dedicated and put a tremendous amount of time to. So I think if we could have their presentations up front, they could then leave the meeting unless they had some other presentation to give, whether it's a school improvement plan or another presentation. So I'm in support.
Okay, that's good feedback. My follow-up question would be for you, Greg, or perhaps Mrs. Frank, even from her experience in past committees or regional, would we consider putting a designated place for the principal sharing, or is there somewhere else where that already fits logically in the framework, if you will?
So the other example is the regional school committee. It is part of the superintendent's report. It's the first item of the superintendent's report, the regional committee. So having a designated spot there might be a good place, as long as the superintendent's report to the committee is early on in the meeting.
Okay.
I agree with that proposal, because I think putting it on as a designated spot will draw, people that look at the agenda and know that there is principals that are going to be making their report. Some people who watch may not even be aware, but if they would see the agenda, they would see it posting. And I think moving it up on the order of the agenda would be a great place to do it.
So is the superintendent's report early on? Maybe we'll follow up on this. I'll take a look at that, and maybe Joan, if we can discuss further, that might be helpful.
Okay, perfect.
Okay. All right. That concludes item B3. I again appreciate all the feedback. Very, very helpful to go through this together for sure. Looks like we just had a hand up, but I'm not sure. Hold on, I'm sorry, I'm disoriented because I'm presenting. What's going on here? There was a hand. No? Okay. All right. Well, that concludes 3B. And just bringing back the agenda here, that would move us to the approval of grants and or donations. So actually, before we do so, are we, the principal, certainly, Greg, it's up to you if you want to, if anybody, nobody wants to be first to go, or did we already? Yeah, they're all still here.
I say we enact the policy once next meeting. Not tonight. No, I'm just kidding. I think we should let the principals continue their evening, not in this meeting.
I actually have one question before. Do any of them have anything to say about the approval of grants or donations, which is next, before they? No. Okay. All right. Principals, we will not judge you. You will not be judged if you leave. We love you and we appreciate everything you do, and we know you have a lot, either other things to work on or rest to be had.
Thank you. Nice to see everybody.
Thank you. Have a good night. Thank you.
Take care. All right, progress. Here we go. Grants, donations. I guess, Greg, I'm assuming you'll, present these, or somebody else on the team?
Sure. So we have several grants and donations to approve this evening, which are greatly appreciated. We have the approval of the Melican, Peaslee, and Z schools donation from masks.com. So we received a number of masks as a result of that donation. We have Keith, I don't know if you want to speak to the donation around the free lunch program. So
that was outstanding. Kind of out of nowhere, we were able to we were contacted by a local business that offered us money, that wanted to see it directly donated to our food services program to offset the needs of our students, and hopefully we'll graciously accept that. Greg, do you have the details on the value of that? I don't have that in front of me.
$250.
Absolutely excellent. So we would graciously love the school committee's approval to accept that donation on behalf of our students and our food services program to be allocated directly to those in need.
And then the last two, we have a Harvard Pilgrim Community Spirit 9/11 mini grant in the amount of $500 for Z School to support Z's work around social emotional needs. And then lastly, a donation or a grant from Harvard Pilgrim Community Spirit 9/11 mini grant, again for the amount of $500 to support for active play. And this was important as a result of what recess looks like in this pandemic. So again, it would be my recommendation for the committee to accept those grants and donations at this time.
Do we need to put a number on the first one, the mass.com? Is there any dollar amount that we should add here, or?
It was just a material donation, so just the donation of the masks.
Okay. So I would entertain a motion reading out the language of all 4 of these bullet points would be excellent. Mrs. Frank?
Yeah, I was going to ask if I could just group them all together, but I guess you answered my question.
Yeah, that's certainly, as long as the language is there, I think we'll take it.
Take it. So do you want me to read all the language, or can I just say as presented tonight? My motion was going to read, I move that we accept with gratitude and much thanks the generosity of the 4 grants that were given to the district as detailed in Mr. Martineau's detailed explanation.
I think that's, oh, do we have a second?
Second.
Oh, thank you, Erin. Yes, so what I was just making a comment, I think that motion is appropriate because we just all both saw them and heard them in all their details. So we have a motion, a second, to approve with gratitude and appreciation all 4 of these grants as presented this evening. Is there any further discussion?
Who wants free money?
I know, right?
Becky.
Oh, the finance person. That's who you have to watch when you make that comment. You have to watch Becky like a hawk. Any further discussion? Hearing none, this will be a roll call vote. Mrs. Frank?
Yes.
Mrs. Bailey Jones?
Yes.
Mrs. Gannett?
Yes.
Mrs. Tagliaferri?
Yes.
And myself, Keith LaBelle, yes. The motion passes unanimously, and with gratitude and appreciation, we accept all 4 of these grants and donations. That would bring us to old business. We have none listed at this time, which then brings us to the superintendent's report to the committee, and I will hand it back to Mr. Martineau.
In your packet are the enrollment numbers for October 23rd, 2020. We are monitoring enrollment very closely. We projected 1,537 students, and at this time, our enrollment is 1,526. So we're 11 students off, which is actually very good news in the sense that as a result of the pandemic, there was a lot of discussion that families were going to unenroll and either homeschool or have their children attend private school. So our enrollment numbers have been pretty stable given the pandemic. I will share that also that one of the challenges that we are facing with enrollment is the shifting and moving that Dr. Reinhorn talked about with students moving from hybrid to the standalone remote program. And I'll just share that this has been a very challenging endeavor for the district. Again, because we have a fixed amount of staffing. And when we have significant shifts from the hybrid model to the standalone remote, it does create a real challenge for us. We have also been working on trying to hire additional staffing for 2 of our grade levels in the standalone remote program. And it's not out of a lack of effort that we have not been able to hire teachers. There's just not a lot of candidates applying for these positions. And Stephanie and Alana and Amy Souls have continued their work, and hopefully in the next couple of weeks, we'll be able to add a couple SARP teachers to reduce some of those class sizes, primarily in 1st grade and 5th grade. So also in your packet is the FY21 monthly general fund expenditure report. And Becky will share the details of that report, as well as give an update on the financial impact COVID-19 has had. And Becky and Keith LaBelle will also give an update on the food services program.
So thank you. Good evening. So in your packet, you will see the monthly general fund report. And you could see that as of October 31st, we have $757,759 or 3.01% remaining on the bottom line. In comparing this report to where we were last year at this time, we had $530,420 or 2.13 remaining on the bottom line. We continue to watch our custodial supplies and our building maintenance accounts. You'll also notice that our teacher line item did see a change, and that is because we have fully encumbered our standalone remote teachers for the remainder of the school year. Anticipating that will continue. And then we have also encumbered additional funds for food services. And so that is something, as Greg said, that Keith and I will address tonight. So what I will do is I'm going to share my screen now. Can everyone see that? Okay.
Yes.
All right. So this is a continuation of the reports that I have been giving at each monthly meeting. So the grant funds do remain the same. And at this point in time, we have not received any additional guidance as to whether there would be an extension to those two grants that do have to be expended by the end of the calendar year. So we are still proceeding and drawing down those grants right now. With the hope that maybe something will happen, but it is not looking as though the act of Congress that is required will actually happen. The next slide is the expenses. And you can see I've added some actual spent so far this year, as well as those funds that have been encumbered for the year. So we are already starting to see some teacher substitutes. If you recall last month, we really did not have a large amount on that line item. But what we've done here is I've listed out our actual expenditures for day-to-day subs, as well as any staff that we have put into long-term substitute positions and have encumbered that for the entire school year. The other piece that I want to point out to you is that I have added food service now as a line item on this report. And at this point in time, we are watching these numbers. Keith and I are meeting pretty much almost on a daily basis, I think, to look at the food service numbers and to see where we're trending. At this point in time, we are anticipating about a $70,000 difference in terms of what our receipts are and what our expenses are. But I will give a little bit more information about that in a few slides. And then I just wanted to also touch on our preschool program, since that is one area that we've been talking about. This slide obviously provides you the information with our actual enrollment numbers and what our estimated tuitions were. But I've broken it down a little bit further for you in your packet. So the estimated tuitions on this slide actually will give you those students where maybe they had reduced tuition because of their economic situation, or they enrolled in the program later. And so we also prorate tuition based on that. So you can see what our, well, I can't say our actual estimated because it's always subject to change, but what we are anticipating for tuition is $276,712. Year to date, we've received just about $52,000. So we do have tuition remaining of $224,000. We have started this year allowing families to pay that tuition on a monthly basis. It's a little bit easier to swallow, I think, monthly versus the larger twice per year payments. And so we are tracking those, and we will be following up with any families who have not made payments so far. So we are trending to the good, where we've received about almost 20% of our tuitions year to date. The expenses, really the only expenses that we have would be, we have salaries, and then we also have health insurance out of the revolving account. And you can see what our year-to-date expenditures are, and then what expenses are remaining. So we have about $210,000 in expenses remaining. So we've done about a quarter of our expenses so far year to date. So the preschool program, with the addition of that remote program, has been, it was a great move on Jennifer Henry's part. It's been well received by the community, and we have seen the numbers actually increase, and she actually has a waiting list right now for families to get into that program. And then lastly, the food service program. So as we had announced previously, the USDA did make the determination that all school lunches would be free for the entire school year. So that means the revenues that the district has coming in are based on the number of meals that are actually served and the USDA per meal reimbursement rate. And that rate is $3.63 5 cents. So we have been using that gauge and really tracking every day. We are doing the number of meals that are being served, and we're closely watching this. What I've given you here tonight is the year-to-date meals served as of October 28th. And you can see that we've done just over 17,000 meals in Northborough. So based on that, our estimated year-to-date reimbursements would be $63,173. With our year-to-date expenses, as well as our year-to-date salaries, right now we are running in the red at $14,704. And the reason for that is we had salaries that were incurred during the month of September. However, we had a shortened school days. We only had 10 school days where we were actually serving meals. And so it's for that reason that we're seeing this, but we expect the trend to actually move into the positive. And in fact, this month, I think we broke even by about $600. So, and so that was very positive news. Our total annual expenses right now, and that is projecting out what our expenses would be for food and also packaging materials, as well as our annual salaries. We anticipate $442,520. So given the fact that our reimbursement rate is set by the USDA, we've calculated out the number of meals that we would need per year, which is $121,739 or $12,174 per month. I'm sorry, not dollars, 12,174 meals per month.
Meals, yes.
So, and actually in October, we did over 13,000 meals. So if we are able to continue to see the numbers increase as word gets out that lunch is free for all students, we are hopeful that we will start to see that trend and maybe see our estimates of a deficit go down.
And I would absolutely echo what Becky said. The month of October was promising. The trend did increase. Those Monday pickup days went up about 30% over the course of October, from the beginning of October to the end. So I think it did gain some popularity and became part of people's routine. And as that occurred, we've tried to be flexible about, where people are able to pick up their meals. Certainly Milliken and Algonquin are the options for Northborough residents, and whatever is most suitable, we make it happen. Milliken has been very busy in their production on those Mondays, especially. On October 26th, they almost produced 1,500 meals that were distributed on that day alone. So that was outstanding. And the feedback has been great. Kyle Parson has done a nice job of keeping the menu options as flexible as possible. One of the things that has hindered that is that our ability to get commodities, which is federal commodities, was hampered slightly. There was a fire, unfortunately, to the distribution center last spring that we've had months of recovery from. So we are waiting on that supply chain to be reestablished, which we got good news today. Becky and I connected on that today and saw a bump in that for the opportunities for our food services managers to get commodity food for their menus, which just is able to add variety, to what we're seeing. So every day, that number of people participating in the program, whether it be through a hybrid or standalone remote or in person, is increasing. We have seen it as people have become a little more comfortable that, these numbers are on the rise. So October, like Becky said, was very good. September was a little rough. We were worried with September. The number of days of school, also with the percent of participation, was lower than we had hoped, but we recovered nicely in October, and we're able to regain some decent momentum. So we're really hoping that carries us through an kind of an average November. Although there are holidays, it is an average number of days that we will see and carry through the end of the year. So November, we will continue to track things well, and hopefully, we'll meet those marks of a number of meals, able to be distributed. So we will certainly have a monthly report for the committee with these updated figures.
Yeah, and just to piggyback off of what Keith just mentioned in terms of November, even on the weeks where there are holidays, we are able to provide families with meals for the entire week. And those are reimbursable meals. So Keith and Kyle have been working very collaboratively and coming up with creative ways to get meals out to families.
And we actually offered the opportunity for some families. We had a few families offer to support and actually make deliveries on behalf of other families that weren't able to get to Melican to pick up foods. And I'm happy to report that we have, I think, 12 families right now currently supported by that program. And these parents have donated their time to pick up the additional meals and bring them to another person's home. We did review with them their safety procedures. We did go over all the mandatory checklists that are required to do that sort of thing, and certainly reviewed any allergy needs that the students had to make sure we didn't have any cross-contamination at all. But the parents have been awesome on both ends and very appreciative. And in fact, in some cases, they've built relationships that they never had before. Granted, it's from a distance and through a screen door or whatever, but we have gotten some pretty good reports that this was a good community initiative, and I'm glad that we started it, because no matter whether it was 2 families or 12, it's 12 more families that we were able to support. So that is always a feel-good moment for the town.
Thank you. Becky, do you have more slides?
Nope, that
Okay.
is the last one.
I see 3 hands up, and that was quite a bit of information. So
sure.
I will take first up, Mrs. Gannett, please.
Thank you. Thank you, Keith and Becky. I have just a couple questions about the food. Things that have come up to me, like people have asked me about and stuff. So one is the food. There are kids that are picky eaters, for example. And so some families haven't applied for the food meals because they know their kids aren't going to eat it. Is there any way that they could be applying and then say donating the food to another family or something to help with the cost? Or is that?
There are strict regulations on the fact that, the only way for us to really count the meal is that if we give it to that child, and in fact, they had to give waivers for that parents or being allowed to pick up a student's meal. So that was even a waiver that was part of the application process that we had to go through. One variation of it that we've had is that, neighborhoods have been able to collect for a neighborhood and then do the deliveries. So we've really worked that through as an opportunity. I will say that Kyle has been flexible. So let's say, for example, if a student doesn't like yogurt or doesn't like a particular flavor of milk, they've been able to make some, minimal changes to the menu options that are available. So Kyle has tried to be flexible and actually has been able to be more flexible in recent weeks because of the variety of foods he's been able to get. So what I would, encourage people to do is reach out to Kyle and say, hey, listen, the menu items aren't really working for me this month. We're not seeing a lot that we would like. We would hate for the meals to go to waste. I would reach out to him and see if you can come up with a system that would work. And he's been able to accommodate most of those cases, although some have been super picky and it just doesn't work out. But I would say for the most part, he's been able to be flexible.
Yeah, because I know that there are families in the district that would love to support and help, with the bottom line. But again, they've got picky eaters and they don't want to have the food wasted in their house. They'd rather it go. So it's too bad that it can't be donated to the food pantry or something but I understand there are guidelines and stuff. And
I bet you couldn't tell someone that they couldn't, but I think that would become problematic for us. We don't want that would be across called contamination, but that would be kind of a conflict of interest in a way. We want it to be direct to the kids that we're serving.
The kids that deserve, yeah. And then so the next question that I have is, about how you were saying about with Kyle and, reach out to him. Have you guys thought about putting out any surveys to see about the food, what's being used and not? I know some people's kids don't eat chocolate milk, and sometimes, they're able to substitute at the pickup, but sometimes they can't. And other families only will eat chocolate milk and not, so I didn't know if there was any kind of surveys to judge how the food's been being consumed.
So I can answer this. So Kyle did survey 3 years ago and got some great feedback around, students' preferences, families' preferences, but it has been some time since we've surveyed families. So Keith, I don't know if you think of the feasibility of doing that right now, but I think it's an excellent idea.
I think it is. And it was actually part of our summer plan of, okay, we're going to get started. We're going to see how it goes. And, we're going to kind of gauge the feedback. We have gotten some feedback, that, it's not working for us collectively and we want to cancel. And Kyle's gone back and said, I'm not trying to say no, but why is it? And they'll say things like the menu options just aren't what my kid likes. And he's like, well, check the December menu or the November menu and we'll see how we can make it work. But I agree with you and Greg. I think it would be time for, a survey to go out. We've kind of got a nice piece of momentum in place, and I can work with Kyle on getting something distributed to families.
Especially just for consumption purposes, and wasting food. Like if there's a majority of families that don't eat, I don't know, the fruit cups, then maybe it would save on cost to not get the fruit cups, to get different types of things and stuff. So.
And there is a limited flexibility with what we can do.
For equal balanced meals, right? Yeah.
Yeah, but if we can, if there's any savings to be consumed by a survey, I think we can absolutely do that and see what adjustments we can make.
Thank you.
Welcome.
Mrs. Frank, please.
Thank you, Keith. Question is for Keith Lavoie. At one time, did we just mention briefly about breakfast being offered?
Yes.
And what is the status on that?
Yeah, I'm glad that you brought that up. We've been working collaboratively with Alana Sear and Kyle, with Diane Thompson over at the Proctor School. And we will be launching a breakfast program there at the end of the month, probably the beginning of December. So families will be able to, or students will be able to, before they begin their day, head to the Proctor cafeteria and will be provided with a free breakfast that is reimbursable to the district. So we're looking forward to getting that started. We've sent out some preliminary communication to families, and I need to connect with Alana on the response so far, and then it will be a formal sign up that we do so that we can prepare accordingly. The other thing connected to that, Joan, is to provide variety to our menus. We are putting breakfast items into the Monday pickup. So you will see things that are 3 more customary lunch items, coupled with something that you would see like French toast sticks, something along those lines, that'd be more of a breakfast item that can be counted as a lunch. That's one of the flexibilities that the program provides. So coupled with the Proctor program and the additions to the menu, that's how we're putting breakfast into the mix.
That's a wonderful idea, because I know when I taught and they would have Monday breakfast or something for lunch, kids loved it.
Yep.
The French toast, the sausage patties, whatever it was, they loved it. That's wonderful news. Why is it only Proctor?
The number of students that qualified for free and reduced lunch hit the 40% threshold last year, I believe. And once it does that over the course of a couple of years, then the school district is actually required to provide a breakfast program. So this was the first year in the middle of a pandemic that we had to launch our first breakfast program in the district. And that's why we're beginning it this fall.
Okay, so once that does get launched, would you be providing us with a cost analysis just like you did for the lunch program?
Yeah, absolutely.
Okay, thank you very much.
Welcome.
Thank you, Mrs. Frank. Mrs. Tagliaferri, please.
Thank you so much for all your information. Keith, did I hear you say that Northborough can pick up at Melican or Algonquin now? Has that changed?
It hasn't changed. We've been relatively flexible. We want Algonquin students to be able to go to Algonquin to get their foods because the portion sizes are larger. So the difference between the two is that Diane Kofer at the high school is able to run her free pickup program through a high school portioned meal. whereas Melican only can do on a K-8 portioned meal. So that's why we encourage families to go to, the correct school for that matter.
Okay.
But when it comes to being flexible and allow it, if an Algonquin family lives right across the street from Melican, it's kind of crazy for them to have to drive across town when they could just walk across the parking lot. So that's the type of flexibility we've provided. And likewise, families can go to Algonquin if they live across the street like you do.
We don't mind going to Melican.
But if it were even a snow day, let's say if it was inclement weather and it's not a time to be driving across town, you could walk across the street and Algonquin could provide you with the meals on those pickup Mondays.
And we do participate in the neighborhood kind of collaboratively, and that's been working really great. So
that has been one of the best adjustments from the spring until now. We really saw an uptick in that, and people, I think it's a feel-good thing to be able to help out the neighbors. It's something that can be done with relative ease, and I've even seen some neighborhoods that are rotating it. Okay, it's your week.
That's what we're doing.
Clear out the back of the SUV and get all the bags and bring them around. I've heard some pretty funny stories about it, so it's working out well.
It's working very well. Yes. Yeah. So thank you.
Thank you.
Thank you, Mrs. Agliaferri. I don't see any other hands up at the moment. I had a question for Becky and I've lost it. Oh, we got hands back. Actually, Erin, are you all set? Yours is still okay.
Just one thing, yeah.
Yeah, please go ahead. Maybe my question will come back to me while you do that.
So for the lunch program, is it just kids K through 8 or high school, or could parents and families who have younger kids, siblings at home sign up for it?
Yes,
like, for example, if I had a preschooler or a 2-year-old, are we able to add those kids into it?
Yes, we are. That was part of the adjustment that was made, and technically, children 0, I think it's to 21. It's not 18. I think it's 21 are able to participate. So we have had some, graduated seniors that are still living at home that are participating through the Algonquin program in some cases. So yes, it is extended beyond that, and it's pretty clear that it is ages from birth to 21.
Keith, can I ask a quick question about that though? When signing up for it, you have to put in. Yeah.
0000. That gets it done.
What's that? 7 zeros?
Yeah, I think 4. It will just fill the field. We've had people skip the field in order to sign up, or I've received the email, and Kyle and I have made it work. We're really trying to make sure we're capturing the students as best we can. But in those cases, we typically have an email that accompanies it that says that, hey, I have a preschooler. Can I participate? And it's absolutely.
And what would the name would you put? Would you put the student's name or the actual child's name?
The actual child's name's fine.
Okay.
Mm-hmm. Because we are cross-referencing it to make sure we're
last name type thing.
Yeah, our students and certainly allergies, anything that pops up on our end, we're double checking those links against our databases.
Great.
Mm-hmm.
Thank you.
It's a hot topic. The meals. Thank you. My question came back to me, Becky. At the very beginning of one of your first slides was the dollars that need to be spent before 12/31/2020, end of this calendar year, right?
Yes.
And there was quite a bit on there, so I had a little bit of anxiety when I saw that. But you look fine, so we trust you. But I'm not quite understanding. Are some of those related to the other side where you're offsetting some of our added expenses? Or is that already accounted for? I'm not quite following. It was a lot of information, so I'm trying to piece it all together.
Sure. So the first slide, and I can reshare that again if you'd like.
Please.
Let's see here. Okay. So the first slide was on the grants that were received by the district. And the 2 grants are the school reopening grant. That's the $225 per student. And then the second grant that needs to be spent by the end of 2020 is the Remote Learning Technology Essentials Grant. And that is a smaller grant, that's $3,737. Keith, believe it or not, with that larger number, the 346,000, we have a plan in place for how that money is going to be spent. The majority, I'd say the two biggest items that we are using those funds on are on substitutes for the standalone remote teachers that we have put in place as part of that program. And then also on technology, because those have been our biggest needs. We've also included the plexiglass that we had put into the schools. We've included some of our professional development activities that were held during those first 10 days of the school year, or the professional development days. And then we have also included some other equipment that needed to be purchased. Like, for example, a couple of weeks ago, Jesse had come out with some recommendations on music lessons and some special masks, and that could be used for students to do music inside. So we've used this grant to purchase those things that would not normally have been on the radar when we built our budget last year. So we do have a plan for those funds. This next slide was really breaking down the areas that we had identified at the beginning of the school year as areas that we were going to watch. And so I had added a column to show what our FY21 budget number was for those areas, what our projections were, the difference between those two items, and then also applying the grant funds and what the difference would be in those areas. And then the last column now shows what we have either actually spent or what we have encumbered year to date. So we have, we're really monitoring this. We actually have a report that is due to DESE next Friday, the 13th, ironically enough, that we need to report out all of our expenses as of September 30th. And then we will have another report that will be due once the grant has closed, so that we can send them all of our expenses and all of the tracking that is necessary for them, since these are federal funds.
Okay, that's helpful. So if I'm connecting the dots, then at the bottom of this grant funds column where there's a total, the slide you were just on.
Oh, sorry. Yep.
Is some of this, does that mean that some of these funds are from the previous slide, from one of the two or any of the three grants? Okay.
Yep. Yep. And in the areas, like you'll see there is a little bit of a difference between the total, and that's because there are some smaller items, like I had mentioned, like the PD. We have facility company coming in and working additional, I think it's 8 hours at Milliken. We've had some other areas that we were able to identify and use grant funds for.
And I have a curiosity, the PPE, was there a reason we couldn't use grant funds for that? Are we out, or are they not allowed, or?
So with the PPE, and then with many of the facility and cleaning supplies, we've actually been working with the town, and the town has submitted many of our items to FEMA for reimbursement, and then it will also be applied with their CARES Act money. So I'm hopeful that soon, once that gets approved, that we will actually be able to remove some of those items off of our budget, and it will be taken over by the town's CARES Act money.
So you said soon, so perhaps some of that information will be coming in as we get into our budget cycle and we know what we're dealing with for this year and start to work on next year.
Yes, I know that FEMA has been a little slow with approving applications, for reimbursement. And FEMA only covers, I believe it's 25% of the expense, and then the rest would have to come from the CARES Act. So once they get that FEMA approval, they'll know what they will be claiming through the CARES Act money.
Okay.
I'll just add that John Kader, the town administrator, and Jason Little have been very cooperative and supportive of using that CARES Act money and making sure that we get reimbursed for the things that do qualify.
Okay. Yeah, I mean, it's funny you say that, Greg, because I just had that thought of visions of you and Becky and John and Jason working behind the scenes to connect all these dots and make sure it plays out in the best way for all stakeholders, right? School budget, but which is town money. So, okay. Any other questions from the committee for Becky and Keith on the budget and food? Okay, hearing none, I would entertain a vote to approve until audited the monthly general fund expenditure report.
Keith?
Yes, please.
Yes, I move that we vote to approve the FY21 monthly general fund expenditure report as of October 31st, 2020 until audited.
Thank you.
Second.
We have a motion and a second. Is there any discussion? So we have a motion and a second to approve until audited the FY 2021 budget monthly general fund expenditure report as of October 31st, 2020. This will be a roll call vote. Mrs. Frank?
Yes.
Mrs. Bailey-Jones?
Yes.
Mrs. Gannett?
Yes.
Mrs. Tagliaferri?
Yes.
And myself, Keith LaBelle, yes. Motion passes unanimously and the report is approved. That will bring us to, where are we at? Capital plan.
So next in your packet is the FY22 capital plan. So Keith LeBoy and Bud Richardson have been reviewing potential projects and touring the facilities to determine what the priorities are for FY22. The capital plan subcommittee met on October 26th and heard a presentation from Keith. And what you have is a result of that conversation and a recommended capital plan to move forward for FY22.
Yeah, and there were a lot of questions asked. I gave all my questions to Joan and she asked them for me.
Okay.
I'm trying to, so does anybody who was not present have questions? It'd almost be good to do a recap.
I think it was just me who wasn't present. Well, I guess Keith, you weren't there either.
No, I was. It was you and Kelly.
I wasn't there.
Oh, okay.
So
I do have a question. So I guess a question and a comment. So I know one of our strategic goals, I think the last one, forgetting the exact verbiage, but it has to do with the, I think it's the appearance of the schools or the feeling of the schools. So, in moving forward with our capital improvements, I think that is in alignment with our strategic plan. I'm curious if in your meeting, your subcommittee meeting, you talked about pausing any capital improvements for this year, given our financial situation.
So I'll just comment that, the next step once this capital plan is approved is sitting down with John Kader and talking about what the financial landscape for the community is. Typically, they fund capital projects for the school through free cash. And it will be interesting to see, how the pandemic has impacted the town's ability to do that. So in the conversations that Keith and Bud and I had, we really tried to scale back some of the projects to minimize the budgetary impact for FY22. But again, we do need to sit down with John Kader and talk about what the town can afford.
Thank you. That helps.
Yeah, and that's pretty obvious, right? When you look at the total capital expenditures line, I'm sure that's what you're looking at, Lauren. And you see that number and you look, you go the next column over. So that was discussed, to Greg's point, trying to be mindful of where we're at right now and what the town can do. So that also means that certain things are getting, of course, deferred, and we're kicking the can, so to speak. So it's something we have to keep track of. We did discuss, in particular, timing of certain improvements that might be in buildings that are due for renovation soon. And there was good awareness there, I think, from Keith Lavoie and Greg and everybody about that. The typical process for major renovations, since there's a few things in the pipeline there. Do you have anything to add, Aaron, about the discussion? Or Joan, anyone?
I don't think so. I know we talked about possibly prioritizing our, items, so that if there is some money that we want to sort of be able to present them with some priority items. But I think that was it. We definitely highlighted the need to look at the projects at especially Peasley and Melican, which are both in the wings to be renovated.
Yes. Other questions?
I think that was it.
I think the only thing I'd like to add is that we did mention at Peasley about the classroom towel replacement, about the old towels, and if any of them were fraying, and what was the condition and how were we keeping up with those. And then the other thing that I just offered for the Melican Middle School was for the teacher chair replacement, to see if we could get chairs that maybe didn't have the upholstery, and just see if those would last longer. I mean, that was just a suggestion, because I know we're dealing with some of the upholstery chairs in the library that have to be replaced, and the wear and tear on those. But I don't know if the other chairs that, I think we've all seen them, that are aerodynamically, set, and they're black and they're created, if those last any longer, I'm not really sure. So it's the durability of the teacher chair replacement.
Oh, and one other thought, because of the canceled school committee tours of the buildings, Keith is going to work on getting us some pictures and some virtual resources to understand what we're looking at.
There are some embedded links in the file, and we can share that with everyone. It's got to be the Google version, not the PDF version. I don't think they transferred appropriately, but we do have some photographs, whether it be of the tennis courts or the gym roof and the science rooms themselves. We were able to get some of that inputted.
Yeah, so committee members, if you have the agenda with links open, and then you use the link from the agenda to go to the capital plan, there are some blue URLs. I just tried one and it did work.
It did work? Okay, good. What do you know?
It brought, I clicked on the snow removal and that did come up.
Yeah, that was one of the good ones that was updated, Keith. So that does have an updated quote attached to it.
So I'll just add one comment, and that was the parking lot and the accessibility project at Melican. I know Michelle mentioned voting taking place yesterday. So it was one example of a project that served the school and the community well and really made a difference and impact. And again, that was a great partnership with the town and the school department. And I believe, Keith, we do have an update on the project for the repair of the sidewalk behind Melican from Scott.
That is correct. Yes, we did hear from Scott Charpentier, the DPW director, about the plan for the back. If you think of it, the Pine Grove walkway that goes out the back portion is on the docket to be repaired this spring. They weren't able to put it into the fall plan because things got tied up, obviously, for a variety of reasons. But it is one of the first things on the docket for the springtime, and I did communicate that with him earlier this week.
Thank you. Kelly, question, comment?
Question about the tile. Is it just regular tile or is it like linoleum tile? I'm just thinking back from one of the things we were looking about asbestos and stuff like that. I know sometimes certain tiles carry asbestos and things like that. And would this be potential of any of that? And would it then schools need to close to like clean it out, or is this stuff that's being done over the summertime?
Yeah, so the tile is asbestos, and the timing of the project would be important. And again, thinking about the long-term projects that we have on queue for Peasley School. And as long as the tile is not cracking or chipping, it's fine. It's best to keep it in place. But as Keith pointed out, that there are some tiles that are popping up and those need to be replaced. And this funds some of those smaller replacement projects. And Keith, those could happen during the summer.
They can, right.
But
it would require a level of abatement, Kelly. It would, so that's why it has to be done carefully.
And that was discussed in detail, Kelly. We covered that topic thoroughly. So your question's consistent with that. We had the same concerns, and in addition to that, we're kind of working through the last few years of borrowed time, trying to make that building last until more significant investments hopefully can be undertaken on renovations. So,
but certainly the safety considerations are taken first and primary. So if we did have a set of tiles that was popping up and was becoming a tripping hazard or any other type of hazard, we will work to get it repaired. But as of now, I did check things out with Bud not too long ago, and actually, knock on wood, we're in pretty good shape. But you can tell that, we are on borrowed time, like he said, and it would be best to keep that as far as a long-term plan to replace.
Thank you.
Welcome.
Mrs. Frank, go ahead, please.
Thank you. Greg, I have a question on the Peasley Elementary School. The last two items, the feasibility study and the renovation. I know these are way out. These are just placeholders. But if we did the feasibility study in FY24, we would not be able to go out for renovation in FY25, would we?
No,
wait. The feasibility study is FY25, and then the renovation is FY26. Wouldn't there be another year in between that?
So this is basically a placeholder, Joan, and we need to work closely with the town in terms of the project lineup. We do think that the feasibility study would be FY25, but it's also dependent on the MSBA process.
Right.
We'd want to be accepted into the MSBA, invited into the MSBA process. And at that point, once we were accepted in, we'd begin the feasibility, and that would launch the real process. So right now it's a placeholder for the most part.
Yeah, I realize that it's a placeholder and that's, far out, but I was just wondering, is that the normal span?
No, it would be, it would probably take a year and a half from submitting a statement of interest to having that reviewed, to be invited in, to then having it accepted, and then for us securing funding. So it's probably a 2 to 3 year project. So to your point, the FY25 feasibility study, that the actual dollar amount for the total project would probably be in FY27 or FY28.
Okay. And then I have another question. Some of the recent reports have come out that if a school district accepts a plan that has already been approved by another district, that they would, if you would use somebody else's plan, that they would expedite the process and you'd be earlier on the docket. Would we be able to use any of the plans from Lincoln Street, since Lincoln and Peasley, we used to call them sister schools? Could we?
Potentially, we'd have to investigate a little bit further. I think the topography of the land is
that's right,
part of the question. And so, but I think they do have their model school program where, again, they try to use well-designed, proven school building projects as kind of templates. And
Mhm.
Lincoln is such a project, so potentially.
Okay, I was just wondering if we could use the same plans, but I forgot about the topography of the land. Okay, thank you.
Any other questions or comments about the capital plan 2022 to 2028? Hearing no other comments or questions, I believe we would like to see a vote on this, if it's the will of the committee.
Keith, I
Yes,
move
please.
that we approve the Northborough Public Schools FY 2022 to FY 2028 Facilities Capital Plan as presented.
Second.
We have a motion by Mrs. Frank and a second by Mrs. Tagliaferri. Any other questions, comments, discussion? Okay, hearing none. Again, it's a motion to approve the FY 2022 2020 to 2028 capital plan as presented. Roll call vote, please. Mrs. Frank?
Yes.
Mrs. Bailey Jones?
Yes.
Mrs. Gannett?
Yes.
Mrs. Tagliaferri?
Yes.
Myself, Keith LaBelle, yes. Motion passes unanimously and the plan is adopted or approved. So Greg, we hand that to you to work on John with it. Let's see what comes back.
So next in your packet, we have the FY22 budget goals that have been approved by the committee. And again, as you know, these goals are so important in the budget process. They really got our priorities. I know we began audience sharing talking about kindergarten as a budget priority. And Keith, as you mentioned, it has been and it continues to be a high priority as part of the FY22 budget goals. Also in your packet is the updated proposed budget calendar. We have added a couple of dates since our last school committee meeting. We've added the capital planning subcommittee meeting as well as this meeting tonight, 11/4. And also I'll point out that budgets are due to the central office on Friday, and it's a good thing that we let principals go so they can work on their budgets because they have a lot of work to do. And we'll continue to update this document as meetings come forth. And that is
have an operational budget subcommittee meeting next week as well. Right?
correct.
I think we do.
That actually, was that confirmed? I think that was confirmed by Cheryl, so that is accurate.
I believe so. Monday?
Yep.
Or is it in 2 weeks? It's soon. Stay tuned.
And that is the superintendent's report to the committee.
3 weeks. I have the 23rd.
Okay, yes, 23rd sounds familiar.
He probably was panicking.
Oh, that's a good way to throw her a curveball. We don't want to do that. Okay, that brings us to school committee member reports. I would propose, Aaron, I think you've been preempted with the capital plan, so I think we're set there. Okay.
Yep.
And so I do know that Lauren has a few things to report on, and Kelly as well.
Yes. So I just wanted to give a brief update about policy development meetings. So we did meet earlier this week. We reviewed 11 policies, believe it or not. A lot of them were brand new policies as suggested by MASC. So in the upcoming meetings, we will be going through those. They're pretty straightforward, but I guess just they are wordy. So just make sure you're reading them before our next meetings when they come up in the agenda. And then Coalition for Equity met at the beginning of October, and we have our second meeting, I believe, next week. And it was a pretty basic first meeting, mostly introductions, and then also really talking about, why each member of this coalition wanted to be part of the coalition and what our work is going to be looking like. And we really did stress that this coalition is not 5 or 6 meetings this year and then we're done. It's really an 8 to 10 year commitment of making long lasting change. So we did have that conversation and we'll be continuing this coalition for quite a long time.
Thank you.
That's the end.
Thank you. Kelly, please.
Hi, I have 2 things to report on. The first is the NSPAC. We have continued to have the monthly support meetings with the student support services and the school committee liaisons. They have they're hosting 2 upcoming presentations. One is going to be on December 10th. They're co-hosting it with Westborough's CSPAC, and it's Zach Smith for Autism Awareness Advocate. He's a former Westborough student and a WPI grad with autism. So he will be speaking on December 10th. It will be virtual, and you could see their website for the exact time and stuff. And then they also are going to be doing on January 21st, they're going to be hosting a special needs estate planning with Amanda Mulhall. And then there will be another parent virtual coffee on November 17th at 10 a.m. So that is the update for the NSPAC. And then my other update is on the free kindergarten group. We heard 2 women speak tonight about it. Greg met with the 2 organizers and myself, and Becky was there also. I'm trying to think who else was there. I think that was it.
That's it.
And they went over again the long haul that they've been in, this the long trying to find the right word for it. Not fight, but battle.
Journey.
Journey. Yeah, that's a good one. A journey. And so it's been a long journey, and the end is coming close. And the school committee and superintendent, we've been receiving emails since that meeting. I calculated 57 different emails about. So there's definitely community support, and it's not falling on deaf ears amongst the school committee members. And we are going to enter budget season and work our hardest to help that, seeing that it is one of our budget goals and stuff. So we appreciate all the feedback that the parents have, and the fight, and the commitment for the groups that are trying to bring free kindergarten to the entire Northborough community. I think that's it.
Yes, thank you. Anybody else? Mrs. Frank? Do you have
Yes.
anything, please?
I don't have anything to share, but I wanted to know if I could make a suggestion, seek clarification on something.
Of course.
Okay. So the first thing is through the chair, and for the chair and Greg, Greg had sent out a data sheet on the number of students in each of the schools, number of students that are in the hybrid and the standalone. And I know that, part of the agenda is the enrollments. And I was just wondering if that could become a document that could be added on to the enrollments, as long as we're in this COVID, so we can just see how the numbers are. That would be a suggestion.
Yes, and Kelly has made that suggestion a couple of times, and we've had the data. We just haven't had it make the packet, so we will make that a regular item until we are out of this pandemic.
Good job, Kelly. Okay, and then the other one, Greg, I did concerning the survey that was sent out to the parents. I made a copy of the data that we had received. So the question that has just the answer Massachusetts to it is the one. The question says, If you selected, I am able to support, and in what amount? It was an open-ended question. Several of the answers were just the state proper noun, Massachusetts. So
You did.
I was just curious about that.
My thinking is they probably think that the state should fund this.
That's why you have the big job. See? That's why you have all the answers. Okay, thank you. All right.
Mystery solved, potentially.
Mystery is solved. I'm like, why Massachusetts? Okay, and then the other thing is that Keith Lavoie sent out the bus tracking application. Here comes the bus that was sent out this morning at 8. And I know it's 8 a.m. I know it's kind of early, but I would like to see that onto the agenda for next month, or if Mr. Lavoie has anything else to talk to us about, since that application just was sent to parents this morning.
Yeah, I will be able to give a report next month. We did have a good first day. We got dozens of parents loaded and checking things, and we are welcoming their feedback as it goes. It has gone through a trial period over the last couple of weeks with success. We had a few parents that have been part of different committees kind of helping us with that trial. The bus drivers were pretty instrumental in it, and hopefully it'll be a reliable and consistent tool for parents to use. So looking forward to seeing how it is implemented and whether or not it'll be utilized.
Okay, thank you. All right, that's it. End of my questions. Thanks, Keith.
Thank you. Anything else from any committee members?
Just one of the things that Joan was saying about the Massachusetts paying for it. Apparently, some people said that it was automatically filled in, that like when they clicked the box, Massachusetts like popped up as an autofill. So they just did it. So I don't know if there's a way to check that out or not, but.
Okay.
To look into it.
That is very odd.
I like the idea though.
Yeah, I like, Superintendent Martineau's explanation. I thought it was really good. I was on the mark.
Okay. Sorry, I have a son retrieving a game controller. The realities of Zooming meetings. Okay, that would bring us then to we saved the quick and easy for last here in this sequence. So we have action on. Oh no, I'm sorry. Way ahead. I was going to do action on minutes. There's not a lot between here and there, but there's no educational policy or policy for development or distribution at this time. Stay tuned. There's going to be plenty in the next meeting, which brings us to personnel items, which I believe is linked in the agenda. Any comments? Pretty straightforward. Okay.
Other than just a retirement to announce, Mark Joffrey, longtime science teacher, and again, we'll have more opportunity to celebrate his tenure in the district in the months ahead.
I've gotten to know Mark through negotiations, so it's bittersweet for him, I'm sure.
Yep, I hear some. He leaves his mark. I hear some things from my middle schoolers, so it's good to see he's well known in the community. He has his place, so certainly when that happens, it's a loss. There's big shoes to fill. So, but we appreciate everything he does for the kiddos. That would bring us. There's no communications listed on the agenda. I don't know if that's still accurate. Looks that way. Which would then bring us to action on minutes. So a very small set here. We do have two. We've got a set of open meeting minutes from the 7th. That was a regular meeting, as well as a recommendation to approve and release. Is that correct, Greg?
That is
accurate. This one at this point, yep. A set of previously retained executive session minutes from the summer.
Keith, I'd like to make a motion.
Please.
I'd like to move that we accept the Northborough School Committee open meeting minutes of the virtual meeting of Wednesday, October 7th, 2020, that began at 6:30 p.m.
Second.
We have a motion and a second. Any discussion? Okay, this is a motion to approve the accept the open meeting minutes of October 7th, 2020. Roll call vote, please. Mrs. Frank,
Yes.
Mrs. Bailey Jones,
Yes.
Mrs. Gannett,
Yes.
Mrs. Tagliaferri,
Yes.
myself, Keith LaBelle, yes. The motion passes unanimously and the minutes are accepted.
I'd like to make a motion to approve and release the retained executive session minutes from June 3rd, 2020.
Second.
Okay, we have a motion and a second. Any discussion? This is a motion to approve and release the previously retained executive session minutes of June 3rd, 2020. Roll call vote, please. Mrs. Frank,
Yes.
Mrs. Bailey Jones,
Yes.
Mrs. Gannett,
Yes.
Mrs. Tagliaferri,
Yes.
and myself, Keith LaBelle, yes. Motion passes unanimously and the minutes are approved and released, will be released. That brings us to future agenda items. There are a few listed on the agenda. We'll be going into budget presentation mode. Looks like NESDEC enrollment projections and recap on the MASS-MASC joint conference. There will be some policies from the policy subcommittee. And Mrs. Frank, this will be part of the standard. What's that? Yep, this will be part of transportation and food services update. You can see Keith's already working on it right now. He's drafting that. He's good. So anything else?
Will we have any reports on any school improvement plans, or when are those planned?
That's a good
Those
question.
will, Stephanie can speak to that, but those will be in the spring, again, because we're reauthorizing school improvement plans as a result of the work that we did last year in the new cycle. So we're thinking April, May, June.
Okay. And will we be doing it with the same format when the school improvement plan, that whatever meeting it was, whatever month, the PTO of that corresponding school would also make a presentation?
Yeah, so we'll have to think about that a little differently this year, but we'll definitely provide an opportunity for the PTOs to present their great work.
Okay, thank you.
Anything else? Hearing none. Approval of bills and payrolls being handled electronically, which saves a lot of lugging of papers around. And that would bring us to audience sharing. So we have 4 attendees still. If anybody would like to share, please raise your virtual hand to indicate that you'd like to share. We do have Susie.
Hi, everyone.
Hey,
I
Susie.
miss sharing so much. I had to share because I miss you guys so much and being at your meetings. First of all, I did want to comment on audience sharing, having it at the beginning and at the end. I know other towns do it for different committees and board of selectmen and everything else. And as a parent of young kids, it's so helpful to be able to log on quick, like I did, I think last month, and speak, and then be able to log off and take care of my kids because my husband had a meeting, or to just stay on until now and be able to get things done and listen to you guys and be able to comment. So I really love the bookend, and I just wanted to say that. Food services, I'm very thankful for, and my daughter is signed up. She's 4. She just turned 4 years old, and we were told when my husband was picking up lunches that she was able to sign up too. So I just want to say thank you for that. And we're going to be putting the word out on our free kindergarten page even more. We tried hyping it up last week too, because I think it's just so nice as a parent and helping the kids out as teach, with the remote learning and everything, to be able to have lunch ready to go. And my kids both bought lunch last year, so it's been great. And of course, I want to talk about free kindergarten. I wrote a unique email, so I just wanted to make sure that you guys all have a chance to review it. I put a lot of work into researching the 2 kindergarten programs between Southborough and Northborough over the last couple of weeks, and spoke to several Southborough parents and made new friends. And I think my mom wrote you an email. She did request email addresses. She taught first and second grade for a span of over 40 years. And there's just no way that a teacher, if they had students from both schools, that they would know, they would be able to tell who is from Northborough and who is from Southborough. I don't think, not knowing what we're going to be going into next year, and if we're going to be hybrid, if we're going to be remote, hopefully we'll be back full time. But if we aren't, you can't just keep putting this on hold. I'm really worried about the students in the tuition and the inequality between the two towns, because they do join up. So I just really hope that you will consider eliminating tuition this year, finding a way. Rebecca and I have offered our services in a couple different areas to try and help this situation, and had some different ideas on it. So I'm sure Kelly can fill you in on all of the details, but I just want to say thank you. And I'm sure I'll talk to you next month.
Thank you, Susie.
Oh, and I'm at 8 Emerson Road, but I think you all know that by now.
We figured it out. Thank you. We have Lauren Fortier.
Yes, hi. This is
Hello.
Lauren Fortier, 22 Assabet Hill Circle in Northborough.
Welcome.
Thank you for giving me a chance to speak. I first wanted to thank the group for making these meetings so available to parents and community members. I know you didn't really have a choice but to go to Zoom, but I'm a nurse practitioner in an ICU that serves our community, and I always work nights. So I really have been so appreciative of the opportunity to participate in school committee meetings while I'm at work. I'm calling you right now from the ICU, sitting in my office, and I've been able to sort of double task tonight and be up on what's happening. I feel like I'm more involved and a more informed parent, and I'm so grateful for that. So I really hope that that is something that is continued, as hopefully we get back in person at some point, but that this remote option is maintained so that parents who don't have childcare or parents who are working can continue to be involved, because I think it's such a valuable opportunity that has come out of a really awful pandemic. And just wanted to follow up to Susie's comments about the full day kindergarten. You know, myself and a lot of other parents have had a really unique opportunity, we can call it that, this year, to be closely part of their children's actual learning path in the kindergarten age. I have a kindergartner right now who's doing the hybrid program. While the remote days for the kindergartners are half days, I've seen that a half a day isn't enough for their developing brains. I know it's what they can do on remote and learning, but when thinking about what a kindergarten brain can do and can learn from, it's a full day that they can grow from. They have the ability and desire to learn about the world around them with content in the morning and content in the afternoon. And I recall my older daughter, who's now in second grade, would comment about the children who would leave halfway through the day. So there wasn't that continued day of learning for her because the teachers couldn't present new information, and there wasn't continued day of learning for those children either in the school setting. Our current model, not the COVID model, of having kids leave is just not optimal. I think COVID has highlighted more than ever those who have and those who don't have in society in so many different facets. Families who are more financially stable can afford tutors, child supervision, or be able to be home with their children and focused on supporting their children through their learning. At this time, families that are more financially stressed may not have those abilities to provide the additional support for their children, and may be trying to work side by side with their child, as a lot of us have tried to do. And let's just be honest, it's not great. And they can't provide that interactive day for their child. So as kids return to school in person, I think we'll need to make up a big gap and provide a full day of enrichment and interaction for all of our students, not just the families who can afford to pay for that full day. So this is the time to take advantage of that and give to our students as much as we possibly can. So I thank you guys for the opportunity to speak, and I also thank you all for the hard, amazing work that you're doing to allow our children to keep learning. I genuinely mean that. So thank you.
Thank you, Lauren. We have Michael being promoted.
Hi, it's actually Kristen. Sorry.
Oh, sorry.
I had technical difficulties on my phone, so I switched to my
Gotcha.
husband's phone.
Hi, Kristen.
Yeah, this is Kristen Tejan from 6 Leland Ave. Again, I would second what Susie and Lauren obviously said. I also have actually 4 kids who are now getting the meals program, which is wonderful. And thank you, Keith, for letting us know about that when we stop by, and all the work you guys are putting in there is really great. I also wanted to comment on full day kindergarten, of course. I have a 3rd grader and a 1st grader, and they are both in the SART program right now. So I've seen them both go through the full day kindergarten program, but spend most of the afternoon really not engaged in learning because some of their classmates in my daughter's class, my oldest, it was 1 student out of 20 who left at 11:30, and in another class, in my son's class, it was 2, and the rest of the class sometimes practiced reading, had rest time, had recess, had other things that really didn't advance their learning at all, because some of the students did go home after the half day. As Lauren mentioned, this pandemic has really highlighted the differences, made it more difficult for so many families. I think it was really obvious towards the end of last year. My son was in kindergarten, and the refund for full day kindergarten was not an entire refund, and there was a lot of discord and discussion, I guess I'll say, among the parents themselves on whether that was right or not. And it seemed that a lot of the parents who were lucky, had 2 jobs still, were able to work from home. As stressful as that has been, working from home and having kids schooled from home, it's financially a more advantageous position. They were okay with not getting a full refund, whereas parents who had a more difficult situation found it very stressful to try and find that extra money, what they were not seeing a result from. So that financial difficulty was exacerbated in some families with the pandemic, and I think that has only grown. So many towns around us have moved to full day kindergarten recently. Westborough moved to full day kindergarten. Shrewsbury has a plan to implement that as soon as they have the space. Obviously, Southborough, we talk about a lot, had moved to full day kindergarten before the pandemic. And so I think it should absolutely be the top priority of this committee to be able to move to full day kindergarten. Since I got involved in this program, since I really started being active in trying to get full day kindergarten, it has always remained a budgetary goal. Multiple years now, I've heard the budget goals be approved with full day kindergarten, either feasibility or moving to full day kindergarten being a goal. And it seems appropriate to quote Joe Biden tonight and say, don't tell me what your priorities are. He says, show me your budget and I'll tell you what your priorities are. And I always loved that quote because it is just so honest about you put your money where your priorities are. So I hope that this committee can move forward now and really put the money towards making full day kindergarten a reality for the good of all our kids, and to really try and better exemplify the mission that is so dear to, I think, everybody in the school system and everyone who is so dedicated in the administration, the faculty, the staff, the students, and the parents. And everyone on this committee, as well as the other school committees who do work so hard to try and get the best for all of our students. So thank you, all of you and others who work at the school too, for all that you do for our kids, because they do have a great school system, but we just need to get this blemish off of the record. And thank you for letting me speak as well. I know it's been a long night for all of you.
Thank you, Kristen. Rebecca? You good? All right. That would be the last of them. So that would be the end of the agenda, barring anything missed, any concerns. I would entertain a motion to adjourn.
Move to adjourn.
It was moved by Moved by Lauren and seconded by Aaron. Any discussion? Hearing none, roll call. On the motion to adjourn, Mrs. Frank,
Yes.
Mrs. Bailey Jones,
Yes.
Mrs. Gannett,
Yes.
Mrs. Tagliaferri.
Yes.
Yes, myself, Keith LaBelle, yes. Motion passes unanimously and we are adjourned. Thanks,
Have a
everybody.
good day, everybody.
Good work.
Bye,
Stay
everybody.
well.
Night.
Be well, be safe.